Hello, everybody. Thanks for coming back to the show. My guest for this episode is Nicolas Smit. Nicolas has been on the show twice before, so if you want to backtrack and check out those previous episodes, if you haven't already, you can have a listen to them. One is quite long because Nicolas and I can really go off on quite a bit of tangents. He's a very easy person to talk to, and I'm very happy to have him back on again. And this episode, we continue with matters that we've discussed in previous episodes regarding such things as a lack of proper protocols from governments and public health authorities regarding PPE. And we also run over the new Omicron variant, social disparities throughout the pandemic, and we discuss his new career as the executive director of the American Mask Manufacturers Association. So hopefully in that position, Nick will be able to see to it that a lot of great progress is made. So I'll leave it there. Enjoy the episode. Cheers. There we go. So we're talking about all sorts of goodies off air, and figured it'd be about time that we actually just hit record, and so everybody doesn't miss out. Mention the mask guidance that you constructed now, and that you're going to be working on with WHN.
Yeah, it's good. I came up with it, I think it was in early October. And right away, people like Dr. Kleigel Ding were sharing with others. Doris Brinspun, the CEO of the Registered Nurses Association of Ontario. And then I made a newer version to make it more friendly for the for even people that were colorblind, because somebody told me that people, if I use the green, red, and yellow, for example, the stoplight system, that the people might have trouble distinguishing between the red and the green. So I made a new colorblind version for it as well. And that's why the version you see with the blue, that's the latest version. And it has a few different updates kind of thing to it as well.
Cool. So what other, are you seeing any other sorts of changes happening with public guidance around masks and all that? Like for instance, there was that little CBC blip that you've shared a bunch of times that happened quite a while ago, where they finally pointed out that not all the masks are the same. And I did finally see on the CBC that they had another little thing on the national that maybe these plexiglass barriers aren't actually doing anything and could actually be making things worse, which a lot of people knew a year ago, and they're just finally talking about it as if it's just this brand new revelation. And I think I've seen Theresa Tam tweet out something maybe a month ago about using better masks, but really most of the main guidance hasn't really changed a whole lot, and most people are still really oblivious to what's going on there. Have you seen any sort of changes?
I've seen changes here and there, but sometimes it brings us backwards. So the Canadian government is now saying again not to use any respirator with a valve because they're too dangerous to use under any circumstance. And they overlook the fact that, for example, with elastomeric respirators, that the CDC has been using them safely for 25 years. They can fully protect even the most at-risk healthcare worker. And that the CDC pandemic plan going into the pandemic was to use respirators with valves and put them into widespread use. And they even have over 600 N95s with valves recommended on their website to use with COVID. So it's still a very weird mystery why the CDC is not letting the public know even about their studies, because it was a year ago that the CDC published their studies saying that even uncovered exhalation valves protected way better than the surgical mask did, and that the simple addition of a surgical tape over the valve could even make it as effective as masks without the valves, but they don't even mention how to cover it. They just say it's dangerous. And they overlook the fact that the surgical masks themselves, without having a brace, they allow so much infected particles to be released from the wearer, and they don't even tell people to use a mask brace. So back in 3 months ago now, in late September, the CDC released studies that were led by CDC scientists, and it even explained without the surgical mask on their own, can only prevent about 56% of virus particles from being inhaled, but it can only prevent 44% of the virus particles from being exhaled to the people around you. But that the simple addition of a mask brace made it over 99% effective. So if something goes from, it has a 50-50 chance of stopping some of the virus particles and even stopping some, or we can stop almost all, and it's just a mask brace addition, why not just let the people know that that's an option? Because so many people are getting infected and they have part of the right tools. Surgical masks are great options. They're just not great options on their own. And people can make their own mask brace at home. Fix a Mask is a company that shows people how to make their own for free at home. And they also sell them as well. But manufacturers also sell combo packs. But if you think that if you're being told your surgical mask is great, that's what healthcare workers use, and that it's a great tool for airborne, because the CBC, they spent the last year saying that healthcare workers are struggling because they want to get out of the surgical masks, they're not effective. And then in the last month, they've been saying, oh, no, you should upgrade to surgical masks. They're great for airborne protection. And they don't even mention the brace themselves. So there's quite a bit of mixed messaging from the government. And it just continues to get worse. And a lot of the good changes are just quiet website updates where I might not even find out for a week because it's just quietly updated on the website with no talk. And even when the U.S. announced the N95 shortage was over in April, most people still don't know it's over. So there was a great New York Times article. I'm not sure if you had a chance to see it. It was just a couple days ago. Andrew Jacobs from the New York Times, he interviewed Aaron Collins, the mask nerd who does all the great reviews.
I did see that. Yeah.
And in the article, it talks about how many counterfeit KN95s there are because they're just so common, and Amazon is like the Wild West in trying to find the right masks, and that the lack of knowledge of knowing that there's so much domestic PPE supply, both surgical masks with bracers, N95s, and elastomeric respirators. It's so misunderstood that the American Hospital Association in late September had to lobby the U.S. government to say, don't put tariffs on Chinese PPE. Our hospitals are still struggling this far into the pandemic, and we have very limited resources for our millions of healthcare workers in the U.S. And we desperately rely on China for PPE because we can't rely on domestic manufacturers. And this is happening at the same time as domestic U.S. manufacturers are sending out the SOS and saying, we lost 6,000 employees. We have hundreds of millions of N95s. Nobody knows they're available. And we can't even advertise because there's still, even though the shortage was declared over, we're still banned from even letting people know we have it. And last month, or in October, the CNBC came out with a news article saying as well to not buy N95s because they assumed that the N95 shortage was still occurring and that they should be reserved only for healthcare workers.
So when was that? A month ago?
That was in the middle of October. I think the journalist wrote that article was Corey Steig.
Mm.
So major news organizations are still telling people to actively not buy N95s because they still think there's a shortage. And if an association that represent millions of healthcare workers in all the hospitals in the U.S., they don't know that the shortage is over and that manufacturers have PPE readily available to protect every single healthcare worker in the U.S., how does the average person have the opportunity to know that they can easily upgrade their protections, that they don't have to stick with cloth masks, that they don't have to go for the Wild West and hope that they play Russian roulette on Amazon and get a reliable mask? And
I think the average person is still at the point, and like months ago, maybe even a year ago, I would be kind of frustrated just seeing absolutely everybody wearing just substandard crap. But that didn't last long. I just realized that, it's not their fault. Everybody has a life. They have things to do. They're not going to be spending time looking into what masks are better. It's all on the government and the public health authorities, where they could be going out of their way to tell people to what mask would be better, but they're going out of their way not to. And it's really frustrating.
Yeah, and they were also, like in the US, they were also supposed to implement widespread regulations for workplaces to have better PPE. And that was the emergency temporary standard. When Biden was running for president, he promised all the workers he would get them upgraded PPE so they wouldn't have to worry about getting infected at work. And when he first got elected when he first took over in January, he said he was going to do it by March 15th. But March 15th, the only thing that came was better protections for workplace inspectors for the government. So the government told these workplace inspectors that schools, manufacturing facilities, warehouses, businesses were now considered at grave risk for spreading COVID around, so that workplace inspectors were encouraged to upgrade from N95s to elastomerics. But they didn't tell the public that. And then when they did finally release the emergency temporary standard on June 10th, it only came for healthcare workers. They told healthcare workers that they were now banned, they were now prevented from using surgical masks around suspected or confirmed COVID patients. And they could only use N95s or elastomeric respirators. But for the workers, they were told to keep, they were told not to use any masks at all, because this was a month after the CDC told the government or told the public that with vaccines were so good at preventing transmission, people didn't need masks. And back at the end of June, since the last time you and I spoke, Bloomberg News actually came out with a news article. They received the original draft of the OSHA regulations, and it actually still stated that workers were at grave risk and they needed better PPE. And when the Biden administration was asked about it, he said, well, vaccines make it more effective, make transmission almost non-occurring, so we don't even need masks at all. And then a few weeks after that, another news organization found out Biden met with corporate lobbyists, and it was corporations that didn't actually want these mask regulations for their workers. Mm-hmm. And I thought, when July hit and we started seeing these studies about vaccines not being able to prevent transmission, and there was that leaked CDC study about Cape Cod where 882 people became infected, and 74% were fully vaccinated. And the majority of people that were hospitalized from that outbreak were fully vaccinated as well. So at that point, the CDC was no longer able to say, masks weren't needed because COVID or the vaccines could reduce transmission. So what happened was the CDC was actually starting telling news organizations to not let the public know vaccines weren't effective. And they were saying, if you start letting the public know they're not effective, less people are going to take vaccines. So it didn't really change people's minds. If they're going to take the vaccine, they're going to take the vaccine, but it would have helped understand that people needed better masking. And then in August, Rochelle Walensky, the CDC director, she said, now with Delta, we know that the virus is one of the most easily transmissible viruses around. And we know the vaccine no longer prevents transmission. So she admitted both those things. And there's still no recommendations for airborne masks, even though the CDC admitted there was airborne transmission in early May. So we could easily stop the spread. Delta never had to get so bad over the summer. Biden would have put in the rules for workers like he was supposed to. Then we could have cut out workplace transmission during Delta, and we wouldn't be worrying about it now with Omicron coming around and trying to say, we just should live with the virus because it's, we know vaccines are effective, but they need to be used alongside with masks. They need to be used alongside with ventilation, because we see now with Omicron that if we only rely on one level of protection, which is vaccines right now, that the variants will evade the immunity and that the vaccines themselves won't keep giving people the great protection and prevent the hospitalizations. And we see in Africa how quickly it could spread. Just 3 weeks ago, there was 300 daily cases per day. And this week on Wednesday, there was 8,600 cases on Wednesday. There was 11,350 cases on Thursday. There were 16,000 cases on Friday and 16,000 cases on Saturday, and a test positivity rate of over 22%. So from 300... 22%. It might have even got, that was for Friday. I think for yesterday's, it might have gone up to 24%. So I'd have to double check for the test positivity rate for that as well. But we're in some...
That's just South Africa or other...
That's just South Africa.
Okay.
So going from 300 cases in 3 weeks to 16,000 cases a day, it goes to show how we're in deep shit if the world doesn't wake up and realize we need to take as many tools as possible to prevent transmission. And if the public is still told in a lot of countries that it's not even airborne, it's going to take a while before these protections go. And even in places like Africa, we keep saying that we need to send vaccines to Africa, but the vaccines aren't getting to Africa in quantities that will actually make a big enough difference. Africa only has a 5% vaccination rate. So if we actually want to help these countries, we also need to send them test kits. We need to send them things to do to improve ventilations in classrooms, like the Corson Rosen boxes. We also need to send them effective PPE. If we do these things, the likelihood of new variants like Omicron developing are going to be so much smaller. And when they do occur, it'll actually slow down the spread, giving countries around the world time needed to then get their countries ready to prepare for these new strains. Because if Omicron is as deadly as in every country or as easily transmissible in every country as it was in South Africa, and then we're going to be in for a really dark winter.
Yeah, and it's here.
and even Christmas parties. There's a big Christmas party in Norway where one person with Omicron, there was 120 people at the Christmas party, and so far 100 tested positive. So that's one person spreading it to 100 others at one event. And we now see in South Africa, there's children as young as 5 now being hospitalized due to Omicron. And at the same time, the governments are saying, well, yeah, it's more transmissible than Delta, which has already made the virus one of the most transmissible in the world. Now it's even more transmissible. And now we're delaying action because we're saying, oh, it's just mild. Well, there's a delay. There's often a delay between infection and the time somebody gets hospitalized. Mm-hmm. And by the time we realize it is dangerous, and we see that already with South Africa with hospitalizations starting to rise, it's going to be too late to then do something that we need to stop the spread, because the spread will already go everywhere. In Canada, it started in Ottawa, then it quickly spread to Alberta and Quebec, and it spread to different parts of Ontario as well. It's in Hamilton, it's in Toronto, it's in the jail in Toronto. So it's quickly spreading, and it's in some countries it's displacing Delta, and Delta displaced all the other previously bad strains. So it's going to be the warning sign everybody's been trying to warn the world about. Like the experts have been saying, variants are going to come up, they're going to be dangerous, and we need effective layers of protection. We need the Swiss cheese model of protection. And right now we just have the Kraft cheese slices that are no good, and everything just gets through those.
Nobody wants a fucking Kraft cheese slice, so it's unacceptable. But yeah, like on Omicron, it seems really clear now, and the Norwegian incident highlights it, is that it's pretty much unanimous that it's more transmissible. They just don't really have an acute sense as to exactly how much. Of course, that's going to take a while, and that there is some sort of vaccine evasion at hand. But then the $1 million question is, how virulent is it? How sick does it actually make people? And so it looks like a lot of people are already jumping on it that, oh well, from this really preliminary data that it's really mild, so it's just going to take over from all the other variants, and that everybody's just going to have a headache and the sniffles, and then they'll get over it from there. But that seems really fuzzy. There is some optimistic information coming out of South Africa already, but it's too little, and you can't really be too sure if it's going to be mild and sort of create herd immunity and then resolve the issue from there. So it's best to err on the side of caution and assume that it's going to be just as bad as Delta as far as making people really sick and sending them to the hospital and so forth.
Especially with long COVID, because we knew even with vaccines don't really do much to reduce the chances of long COVID. So even if it's only as bad as Delta, and Delta is already really bad, if 10 to 30% of the people get long COVID, and so many more people are now going to get infected in a short amount of time, and they're getting reinfected. So people that were infected with Delta are now getting infected with Omicron, then their chances of developing long-term disabilities are going to grow. But that's not even the discussion. The discussion's only hospitalizations right now, and it's too early to tell. And right now it's the even though there's a 32-year-old woman who traveled from South Africa back to Israel, she had received her third dose. She was healthy. She received her third dose 2 months before, and she still got infected. So even with a third dose, you can easily get infected. And right now, the only train we're hopping on is, well, that it shows why you need your booster dose. Okay, no, it shows why we need fucking masks. It shows why we need ventilation. It shows why we need common sense. It shows that, just we can't live with the virus, because obviously living with the virus created this dangerous mutant. And it's also the first time, to my knowledge, that COVID has also mutated a little bit with the common cold. So Omicron has discovered that there's genomic sequences from the common cold. So now we have COVID and the common cold together, and it looks like there's different mutations that are similar in Delta and UK, and they're all combined in this one. So it's like a COVID on steroids.
Megavirus.
Yeah, it's a mega virus. and if it can do the common cold, then it, is it going to be easier to evade like PCR testing? Because a lot of people, that's why it's spread in their countries, because they did their testing and they came back negative, and it was only on the fourth or sixth test it came back positive. So are we going to be able to rely on testing like the way we did going to date, or are we going to have to find better testing techniques to make sure it's accurate? And also, the thing that was different from Delta, which took a while to understand, is the incubation period from the original strains were 6 days, and with Delta it was 4 days. So is it going to be 4 days with Omicron, or is it going to be 2 days? It's going to go like how quickly can it spread? If the spread is going from 8,000 cases a day on Wednesday to 16,000 cases a day on Friday, then maybe the incubation period is a lot shorter than even Delta on average. And if it's displacing Delta, then that means the higher viral load could be a lot more than 1,000 times the original strain. If it displaces Delta, maybe it's 1,500 times, maybe it's 3,000 times the original viral load as the original strain. And it's gonna take a while for us to understand exactly how bad it is. But the warning signs are there. We're just not listening to them.
Yeah, I didn't know that about the PCR tests.
Yeah, I think like the case in Hong Kong, the person tested negative four times, and it was only on the fifth or sixth one they tested positive. And they ironically, I think that was also the same one where news organizations were trying to spread more misinformation about valves. And remember, I think it was the Washington Post. They're like, yeah, this person was selfish because they wore a mask with a valve when they answered their door in the quarantine hotel, and then so it talks about how the valves could make the virus easily spread, and then right at the end of the paragraph, and the person also frequently wore no mask at all. So
I wonder which it was.
And it wasn't even that. After it was found out that the hotel was actually sharing the air between rooms. So it wasn't even the fact that the person was answering the door in the hallway to get their food. The rooms were sharing air. So I don't know who would be wearing if I'm in a room by myself, in a hotel room, I'm not going to be wearing a mask 24/7. And so, they need to have improved ventilation, but that's not even something to discuss. They try and say, this person spread it because they had a valve mask, even though we know valve masks are much safer than the surgical masks everyone is wearing. But nobody's telling the people to upgrade their surgical masks to add bracers, because surgical masks are great tools, but unless you're using the tool effectively, then it's not really going to do much for you.
I wouldn't be surprised if they just start making people in hotel rooms just wearing a mask while they're in their own hotel room, and just a surgical mask, just so they don't have to address the ventilation issue, so they can keep pushing that down the road.
Yeah, or even put in Corsi Rosen boxes in hotel rooms, or put in different filtration units in the rooms. Mm-hmm. It's easy to do, especially if it's in a quarantine hotel. Most likely people are going to have these. The likelihood of having somebody with Omicron or Delta is going to be high. Mm-hmm. So that's where you're going to need them. It's not necessarily in every hotel, but in the hotels that are at least serving as quarantine hotels, those are the ones at risk. And then you have also all the employee hotels, security guards, making sure that people are staying in their rooms for the quarantine that are going to be at risk. And, if the people that aren't infected, spending a week in a hotel where you're sharing air with your next door neighbor who does have Omicron, you're going to get infected when you wouldn't have been infected if there was better precautions.
Looks like the better ones are like the ones that they have in Australia, where you're just in your sort of your own little unit, and then you don't have to worry about sharing air. The ones that the really right-wing nutcases are calling the concentration camps. Where you're in like your, like, it's not a hotel and they set them up and you're in like your own little mini suite thing and they're all kind of disattached
and that's something I never understood is people on the right and people that are anti-maskers or anti-vaxxers, they try and compare people that are trying to get protections as concentration camps or Nazi doctors. I don't know if they didn't learn about history, but the Nazis tried to exterminate and kill people, and the people that are trying to get people to get vaccinated en masse are trying to save as many lives as possible. So if you're trying to tell people not to take the things that they need to save their lives, then that's going to be what's killing people. It's when Nazi doctors weren't there trying to save people's lives. So it's such a strange comparison, and there's not even very much pushback from a lot of people.
It's a really repulsive comparison because it's even worse than that. So even just grant them a lot of things which aren't remotely true. Like let's say, let's stick with Australia. Let's say Australia is like really like snapping people up and like forcing them into these camps, and you can see there's tons of pictures and videos of what they're like, and they're not that bad. But like from what I've seen, the ones in Canada are worse just based on like the quality of food that they got. I did see like that's about as bad as I've seen things. It's like I've seen some pictures of like really crummy looking lunches at some of the hotels and quarantine hotels in Ottawa. That's about as bad as I've seen it. But let's say that they're really pushing these people in there and all that. Like to compare that with actual concentration camps, or specifically they have this weird focus of putting it of comparing it with the Second World War Nazi concentration camps. The severity of brutality and the industrialized organization of mass slaughter with the final solution is just so extremely incomparable to what is going on, even if you grant like the worst case scenario, which is of course patently absurd, the worst case scenario as to what's going on there. It just shows either a completely grotesque immorality or a complete ignorance as of history of the last 100 years. It's just it's mind blowing the amount of people who I've seen glom onto that, and like the big one I've seen in the last week is the comparison of Anthony Fauci, who I detest, but comparing him to Joseph Mengele. It's like, how do you live with yourself if you make that comparison? Like it's just mind blowing. Somebody who would snatch up people who were starving and imprisoned based on their ethnicity and putting them through the most grotesque medical experiments, and comparing that person with Anthony Fauci is just you need a psychiatrist if you're saying things like that.
Especially when these same people are then saying to, take a horse pill and take this unproven drug and take this and take that. Don't take what we know is safe. Take something that's made for a 1,000-pound animal and hope for the best.
Yeah. That has there been a lot of that of people actually taking the ivermectin that's meant for livestock?
It was bad in the U.S. I'm not sure how bad it was in Canada, because I think there's less of it in Canada, but it was really bad in the U.S. And I think there was even, I forget which state it was, but there was a judge who told the hospital to give it to a patient who wanted it, even though it was banned. So it's still happening. Like people are still taking it. Like Joe Rogan will tell you to take this or that kind of thing. Dr. Rogan, I'm sorry, Dr. Rogan. And and then like people end up getting, they get really sick. Some of them might die. I mean, it's not as bad as Trump telling people to just drink bleach, but it's still on the spectrum.
Yeah, I don't think Rogan's ever like. Maybe he has. Maybe I've missed it, and like I don't think he's telling people, but he does have an audience of many millions, and he makes it clear that he doesn't want the vaccine, and that he's just on the vitamin regimen, which he does get a lot of flack for. And he's right on that. People should be amping up their own personal health, but the big one is that he has the ivermectin as the proxy for the vaccines, which just is not wise. And maybe we'll find out down the road. There doesn't seem enough to remotely substantiate it, but maybe we'll find out that it does have some adequate prophylactic value, but I haven't seen anything of that yet. And so in him like doing that, and a lot of people follow his lead, and then they end up, and if they do get their hands on ivermectin that's actually meant for humans, not cattle, then they're unlikely to take too high of a dose of it. But the big thing is that they're missing out on the vaccine, which is something that they should not be avoiding.
Yeah, and I think it was on Colbert. I saw they were talking about the everybody asking for a horse dewormer. It ended up being so there wasn't enough left for horses. So everybody was going to the livestock places where you can buy things for horses and cattle, and then buying it, and then there wasn't any left for the actual animals that needed it.
Really?
Mm-hmm.
Oh wow! Yeah. Okay, I didn't hear about that. That's depressing.
Yeah,
that's
some of the
very,
best
very
information,
depressing.
ironically, you can get is from a lot of the night shows, because they'll look at all the stories and see which ones are the most fucked up, and then they'll share those ones. And these are the ones that a lot of news organizations might not even touch. So it's interesting that like Colbert, Kimmel, and all those people, like they have some great monologues, and a lot of the information I learned from sometimes comes from the show, and then I'll look into it further. But they have some great staff that actually do a lot of research and look into the problems. And even with Omicron, they're warning everybody about how dangerous it is right now.
Mm-hmm. I'll have to look into that because I imagine veterinary supply places would only carry so much of livestock medicine. And so probably wouldn't take much for a spillover of people buying it for alternative reasons for them to start having a supply shortage there. And if that is the case, then there's bound to be a lot more people who are going to end up in the hospital from taking just way too much. You can't really, I'm sure everybody can fill in the blank on how bad of an idea that is. But yeah, that's depressing.
Yeah, it's depressing, but at least it's starting to slow down a little bit. But I think right now a big problem is a lot of people still are afraid of the vaccine, so they're not taking the vaccine. So they're trying all kinds of alternatives, but the alternatives are very dangerous, and they haven't been tested on people, and it could end up killing a lot of people just because you're afraid to take a vaccine. And the vaccines are what people have been taking for decades. Children take vaccines all the time, but all of a sudden, because it's being politically charged, people don't want to take vaccines for COVID.
And so I think that sort of ties into what we were talking before about the masks. Is it seems that the government is having such a hard time getting people to take vaccines that they're not willing to really be forthright about the fact that vaccines are very excellent at making you not get ill, and of course then stay out of the hospital, which is good for you because you don't want to end up in the hospital, as well as everybody else, because then the medical system doesn't go down shit creek for the billionth time. But they seem very reluctant to point out that it only has so much effect as far as transmissibility, because that was sort of there was one thing that a lot of people were hoping for, is Kate, because people were so sick of masks and all that okay, once we get the vaccines, then we can just give up on everything else. Everything else goes in the dumpster. We all get the vaccines, and everything else we throw away. And so there seemed to be that the governments wanted to leverage so much more on the vaccines just solving everything, and so they seem to want to be less clear that it's not as effective as one would think on transmissibility, and so that because they would need to do that as a part to ramp up their mask messaging. So that might be part of it, as well as the I wonder if at this point they just don't want to admit that they've been wrong for so many months about masks, and just saying that, okay, well, we advised you to just wear these surgical masks, or really any mask, for this long now, that they don't want to deal with that egg on their face. And that sort of alludes to what you're mentioning before, how they're quietly sneaking in updates. They're not making big announcements for their updates. They're just sort of sneaking them in there one little bit at a time.
Well, yeah, even look at Canada. They on November 12th, they announced on a Friday afternoon, to try and avoid any kind of media coverage, that they admitted it was airborne. It could linger in the air for long periods of time. It could float in the air. And did we get the precautions that healthcare workers were asking for the last 2 years because it was airborne? No, like even the opposition politicians are not saying, we've fought for the last, or workers have fought for the last 2 years to get airborne protections. And the courts have said, no, they can't get it because there's no evidence of airborne transmission. So now the government has admitted it's airborne. So what's now delaying the protections workers should have got 2 years ago? We knew from the precautionary principle, we should have taken the precaution that it was possible to be airborne, and it would have saved so many lives and prevented most of the spread in Canada. We could have prevented lockdowns if we would have actually followed the precautionary principle. But we now know a month ago that airborne is happening, and we're not even using the common sense principle, where we now use airborne PPE to stop an airborne spread. We still say, the focus should be on hand washing, even though hand washing or surface transmission, if you have a surface that is contaminated, you only have a 1 in 10,000 chance of getting infected from that surface.
It's that low.
It's that low, and unfortunately, if you don't
knew
have
it was
proper
really
mask,
low, but I didn't even think it was that low.
It's 1 in 10,000. So it was called when people found out how low it was called hygiene theater, I believe, was the term. And we lost all this time hand washing when we could have been learning about the effectiveness of masks and using mask bracers with surgical masks, because it's not new knowledge. Even during SARS in 2003, the CDC was saying that at that time they needed to use a precautionary principle because they didn't even know if the original SARS was airborne, and they didn't want to take the risk at that time. But for some reason, 20 years later, they wanted to take the risk. And in the US, there's 4,000 healthcare workers that died from COVID. So how did that turn out for the US, not using the precautionary principle or even using the principle now going forward? And how come it took a month after the US declared that it was airborne for them to ban the use of droplet protections only and surgical masks, and they still don't promote mask bracers even to this date in the US? They'll just say, high use clips or something, but they'll not say to use a mask brace. And people can make mask bracers at home. So how many lives could have been saved if people would have known to just simply add a brace to their surgical mask? Because surgical masks are great. They will stop the virus, but they're not going to stop the virus on their own. It's like you can have a car and you can have a seatbelt, but if you have a seatbelt and no car, it's not going to really help you. Or like an airbag and a seatbelt and brakes. If you have an airbag and you have a seatbelt, that's going to be great. But if you don't have brakes in your car, you're going to be going at full speed into whatever you crash into the stop. And we can easily stop the transmission. We've had the tools for a long time. On April 9th, the U.S. declared that the N95 shortage was over. And on March 1st, U.S. manufacturers from the American Mass Manufacturer Association, they wrote an open letter saying, we have hundreds of millions of N95s. We can protect every single American with airborne PPE, so they have effective masking. And the U.S. government said, okay, well, you know what? In a month, we'll let the public know that the shortage is over, but we're going to send letters and do an update on a Friday afternoon. We're not going to talk to journalists. So it wasn't until September that the CDC actually told the public that they could start using N95s. But again, it was a Friday afternoon update with no talk to journalists. So major news organizations a month later, and even the American Hospital Association, didn't even know that there was an N95 shortage was over. And they assumed that all kinds of risks still needed to be taken. We don't need to keep taking risks. We just need better communication system. And there are some great politicians out there. So in the New York Times article that came out on November 30th with Andrew Jacobs, there was they talked about an open letter signed by 11 Senate Democrats, including Elizabeth Warren and Bernie Sanders and Richard Blumenthal. And they explained that because the Chinese manufacturers are being able to flood the U.S. market, it's putting all the U.S. at risk, and that they said that there needs to be more support for domestic manufacturers because it's a national security issue. So they're looking to add tariffs to Chinese PPE to try and discourage the flooding of counterfeit. Because if you're a counterfeit maker and you all of a sudden have to pay tariffs, you're less likely to then try and ship your PPE to that country. And then it's also going to be an added cost. So if people are just looking to save 10 cents, they're not going to, and they have to pay that 10 cents in a tariff, then it equals out. So it doesn't make it more easier to then buy counterfeit PPE than buy whatever PPE is available and the most effective one, so you can find effective sources. So there are some politicians that are doing some great work. Unfortunately, there's not enough, and they're not being vocal enough when they're doing the great work.
So do you think at any point that things are actually going to change? Do you have any optimism that things will turn around and that we're going to stop seeing people religiously cleaning the counters at the grocery store and, actually start wearing masks? And I even still see people wearing face shields from time to time, which is just, it's so shitty. It's impressive. But and then not to even mention proper ventilation anywhere. Schools is the big focus, of course, but all sorts of places should have an improvement in ventilation. Do you think there's ever going to be a change, or is it just once this pandemic's over, it's all going to be retrospective and saying, oh, we should have done this, this, and this. Now that it's all over, a bit easier to take care of that, and then setting up something for posterity.
So I think there is going to be change. It's definitely going to be coming. Omicron is going to show why the strategy to date hasn't worked. And it's going to show a lot of weaknesses as well. And unfortunately, Canada is going to see it in the U.S. first. So if you want to see that happening, Canadians are going to have to look across the border, because there's quite a bit of a delay between when the U.S. does something and when Canada does something. For example, the U.S. admitted that it was airborne. That it was airborne on May 7th, but the Canadian government didn't say it until November 12th. So I don't know why it would take so long for Canada to admit it after the WHO and the US had readily admitted it, but it took quite a long time. Even when vaccines are approved, I think it was approved for 5 to 11-year-olds in October for the US, and then Canada's like, well, we're gonna wait another month or month and a half before we do it, and then because of pressure, they moved that date as well. But the changes are going to come. They're slowly going to come in different countries around the world. It's going to be hard to see all the changes, because a lot of them are going to come quietly. And so the important things are for people to make sure that when the changes happen, that people do know about it. So that's why COVID on Air and all these podcasts that talk about COVID are so important, because often journalists don't know about it. Information gets compartmentalized. So it's up to grassroots movements often enough to spread the message about all these changes. And, you can look at great people like Dr. Eric Feigl-Dang. He'll usually let you know about the problems months before the government does, because he's one of the smartest guys around, and he can let you know, he was saying back in May, like vaccines weren't effective in stopping transmission, and even in June, it's because of Eric that I noticed that even in the UK, out of the first 255 people that died in the UK from Delta, 118 or 46% were fully vaccinated. So I knew right away back in June that we needed to do something more than vaccines, and it was urgent to really get those airborne protections to workers because, we knew in June from Israel and from the UK that vaccines weren't stopping transmission. People were still getting long COVID. People were still getting hospitalized. And then slowly the US would finally admit it. But at first they were saying, well, don't pay attention to what's going on in Israel, UK. We have our own studies. And then they're like, okay, well, we don't even need boosters. 2 doses are good enough. And then eventually they'll say,
because the Brits and the Israelis, like, they can't do studies.
and they're also Israel and Britain. And they also try and say like, well, that happened there. But if you look in the U.S., vaccines were good. Since in the last year and a half, there hasn't been really that many cases of people getting vaccinated, getting testing positive. But what they don't tell you is they don't track the breakthrough cases. The CDC stopped tracking breakthrough cases for a while. And often the only time you get tested for if you're fully vaccinated is if you're in the hospital. So then it really changes the numbers, because if only the people that are unvaccinated are getting tested, and then only a small percentage of the fully vaccinated people are getting tested, because if they're told, you're fully vaccinated, so you don't have to be tested, you can be at home, what you have is a cold, and then they keep spreading it to others. It's going to be quick changes, I think, this time around, because this time the economy is really at risk. You have the holiday season, you have supply chain. All kinds of problems around the world with the supply chain. You have Omicron quickly spreading. You're going to have all kinds of Christmas parties. You're going to have holiday shopping. So people are not holiday shopping with the proper masks. So it's going to end up quickly spreading around the world. And even in June, in the shopping centers weren't as busy as this time of year. And the UK government and the US media, or the Australian media, was already telling people that people were getting infected within seconds just by walking by somebody in a shopping center. So if Omicron is even more deadly, then without the right mask, it's going to take seconds again to infect a lot of people. So
more. I think you said more deadly. I think you meant more transmissible.
Oh, sorry, more transmissible.
Yeah.
Sorry, my bad. So if Omicron is more transmissible than Delta, then Omicron should take probably seconds as well to infect somebody, especially if people aren't wearing the right mask, because a lot of the times they're still told you don't even need masks. So even once the government said it was airborne, or opposition politicians would, in Canada, for example, weren't even saying, now use airborne PPE. They were saying, okay, get your booster, wear a mask, and wear a surgical mask. But then the opposition wouldn't even tell people that you needed a brace. And they weren't telling the public to start using N95s. They're still not even advocating. And if you look at, for example, the Ontario Liberals, I thought they were going to do, I've been asking them for so long to speak up, and they refused to. Back in February, after a 4-month delay, the Ontario Minister of Health told, at that time, the Ontario health critic for the Liberals, John Fraser, that hospitals could easily get access to elastomeric respirators if they wanted, but the public was too stupid for it to be worth letting them know. And then he was supposed to be working with federal Liberal Ryan Turnbull to then pressure the government to distribute them. Of course, the federal election took precedence, so they decided to say nothing at all. And then Ford gave them back that favor by not speaking up against Trudeau during the election, which normally, the Ontario Conservatives and the federal Liberals are at each other's throats during the elections. But all of a sudden, they were buddy-buddy. So they didn't want to say anything. And then John Fraser waited till a month after the election to finally ask the questions he was supposed to ask in February. And I asked him, okay, now, last time it took 4 months to answer. We can't wait for delays. We need pressure for the government to answer right away. And last time they only gave a 1-paragraph non-answer. And I said, I'm afraid if you don't speak up, there's not going to be any pressure to get the government to give you any kind of answers. And they're going to try and just get away with not giving you proper answers. But John Fraser refused to speak up, refused to even mention elastomeric respirators. So if you actually look at the Hansard transcripts, which is what the government uses to, whenever somebody speaks in Parliament, there's a Hansard transcripts of what they say. And if you Google elastomeric respirators, it was not even brought up once to date in the Ontario Parliament. And it wasn't until December 2nd that John actually got his answer, because he didn't want to speak up. He didn't actually want his answer. He just wanted to make it appear as if he was trying to get answers. So he could say, oh, look, I spoke up. But then a month after he started asking for answers, then Canada admitted it was airborne. So they started asking for more vaccines, and they avoided talking about masks. And then he got his answer on the second. And the answer was, well, hospitals could easily have access to the elastomeric respirators. All healthcare workers need to do is ask for them. But then she tried to spread misinformation. She said, oh, well, they're really hard to use because you have to don and doff, which is putting it on and off, and you have to be fit tested. So I don't know what an Ontario Minister of Health does I don't know why she's a health minister. She doesn't know that N95s require the same thing as elastomeric respirators. So if it can be done for N95s, why can't it be done after 2 years for elastomerics? Especially when the American College of Surgeons in June of 2020 showed that thousands of healthcare workers could easily be fit tested within a week and trained and evaluated. So we lost so much time. And then the Ontario minister also tried to make it appear as it would scare patients. So she said, well, another thing we have to be careful is they could scare patients. So what is a patient going to be scared of? A hospital where every single healthcare worker is fully protected so they don't get infected at all and they can't spread transmission, or a hospital where healthcare workers are walking around in leaky surgical masks without bracers, where people keep getting infected and outbreaks keep happening. And they don't know if the healthcare worker they're going to be speaking with is only going to be in a surgical mask without a brace, and then they could get infected themselves. And to even add to the more confusion, she also indicated that the elastomeric respirators had valves, which made it dangerous to use. So she completely ignored the fact that over a year ago, Ontario Health explained that the valves could easily be covered and they weren't dangerous at all. And so why after all this time, does the Ontario Minister of Health still try and spread misinformation? And now that John got this answer, why is he not speaking up? I had to help get somebody in one of my advocacy groups. She ended up contacting the Ontario government. She got the answer for me because it arrived on the second, and I only got the answer, I think it was 2 days ago. And now I'm trying to ask unions to speak up, because what's happening is unions refuse to even mention the word elastomeric respirators. During the summer, when the federal election was happening, CUPE had 4 CUPE members, including a top health and safety representative running as NDP politicians. So I said, oh, this is perfect. You're a health and safety rep. This is a perfect opportunity to raise during a federal election that Justin Trudeau's keeping the Canadians in the dark about elastomeric respirators, and that healthcare workers still struggle. And CUPE and NDP are like, no, it's not important. We have other things to do. And then the NDP, or one of the NDP candidates, tried to say right a week before the elections were called that if the NDP ended up getting elected, they would put reusable respirators into widespread use. So I asked her, like, why does it have to wait till the NDP gets elected? Why can't they're available now? Why can't you just ask for them to be distributed? And she said, well, we don't really know if they can be used. Is there storage? We don't really know if there's storage, and there's different issues. I'm like, they're already there. They take up less room than N95. So why would you refuse to talk about it? Because you say it's only possible when the NDP get elected, even though it's been possible for this entire time. The NDP just won't speak up. And then I asked people like Michael Hurley, the union leader for CUPE, to ask the NDP to speak up. And he said, oh, no, it's not important. I have asked them to speak up, and they are speaking up. And I said, well, no, here's the proof. Here's a Hansard transcript that they didn't speak up. And he's like, well, they say N95s are better. So there you go. There's your proof that they talk about elastomeric respirators. I said, well, how is N95s are better going to help? Because people don't know what better is. NDP is actively saying that that CUPE is not even asking for elastomeric respirators. And it's not talking about the stockpile. It's not talking about the healthcare workers that are actively not able to use them because people don't know they're safe. So how is N95s are better helping with elastomeric respirators in the problem? It's only helping the government get away. And he said, well, it's not really important. We'll talk about it at rallies, and that's all we need to do. And then I even showed him the NDP Jamie West's tweet saying that he would help, but unions are refusing to ask for help. And as far as he's aware, unions aren't even asking for it, and they don't want it. And then Michael saw that. He's like, well, Jamie's not in our portfolio taking care of this. So he's not knowing. So I said, well, if a top NDP critic who's asking for N95s on a weekly basis in government doesn't know this, don't you think that's a problem? Don't you think the average person wouldn't know it either? If CBC took 5 months to do the investigation because they say unions aren't speaking out, isn't that a sign that unions should be doing more? And why is issuing a social media post beyond something that can't be done? Why can't you work with the NDP politicians to speak up? And then they decide to not mention it at all. And now I'm trying to get the unions to say, if Ontario government said that hospitals can easily have it, just take that back to court, because they went to court to try and get them distributed. And the judges said, well, no, the government says there's no airborne and they don't need it. But now if Ontario says they're readily available, the government can't then say we can't give these to healthcare workers, because they're now on the record for saying healthcare workers can have them and all they need to do is ask. But now the unions are the one that don't want to ask, and they want to keep healthcare workers unprotected because the unions don't want to look bad for not saying anything sooner. So until there's pushback against the unions and the unions start asking for it, then the NDP politicians and the Liberal politicians as opposition critics, they're not going to have incentives to then speak up themselves. So then the politicians that are in charge have no incentive to change, because everyone's just looking the other way and they're just letting them get away with it. There's not even so much as a criticism or a post on social media about how many healthcare workers continue to be put at risk because of this.
So from the standpoint of the unions and the New Democrats, what do you think is really what's their incentive to keep being so hardline on this position? I just don't get it.
I don't know. They say they only care for N95s. They only ever really advocate for N95s. It's the only PPE they talk about. They'll sometimes say better, but they won't say what that better is. And N95s are great, but we know the 100,000 last American respirators are already paid for. They're already there. They've been sitting collecting dust, and they also offer better protection than the N95s. So why can't they be used? If Michael Hurley back in June, after the UK study showed that FFP3 respirators, including elastomeric respirators with P100 filters, can fully protect even the most at-risk healthcare worker. And he tweeted, what the Cambridge study shows, it could fully protect healthcare workers. There's no reason why we need 100,000 elastomeric respirators in warehouses. But then he realized how important it is, but it's not important enough to ask politicians you speak with daily to then say, Mr. Ford, it would be nice to get these respirators. Mr. Ford, our healthcare workers are dying. We're the NDP saying it's important to act urgently and without delay, and we should do everything possible, but it's only everything possible if it's for an N95, and they won't even ask. And it doesn't even make sense to lock them up, because they're readily available. If they wanted to buy more for future pandemics, they could still buy more for future pandemics and give healthcare workers the one they have right now. And they also have ones without the valve as well. So there's healthcare worker versions. So they can easily buy even better versions that are made specifically for healthcare workers. So why are we losing all this time? And the unions, another thing the union had said, if you don't talk about elastomeric respirators, you don't criticize the government for it, then other workers, so meat plant workers, school teachers, they're not going to know how to use these either. And then they're going to be getting infected and putting your healthcare workers at risk. So at least speaking it up will raise awareness, so other workers will know what to ask for it, and other unions will know what to ask for it. So CUPE is a hospital union, but they also represent all kinds of other workers as well, and they could easily fight for it. So the federal government, for example, they admitted that the virus was airborne. So all those postal workers are federal employees. Why isn't the postal union now saying provide our workers airborne PPE now that you admitted it's airborne? Why are you leaving our letter carriers, our clerks at risk, especially during the holidays when they're busier than ever? Why are you leaving them at risk when you yourself admitted it was airborne? So there's no real attempt for changes. And so many types of federal employees should at least get the protections, and at least that would show that there's airborne protections, and then people could see, if federal workers can get these protections, why can't other people as well? But if we keep everybody unprotected, then it's easier to leave everyone at risk. And even admitting it's airborne, so the the Canadian government admitted it's airborne, the provinces are still fighting and saying it's not. So why is the federal government not going saying, no, provinces, we admitted it's airborne. If provinces don't admit that it's airborne and don't immediately protect workers with airborne PPE, we're going to withhold federal funds. We're not going to give you COVID relief if you're not even going to be protecting employees in your provinces and letting it spread in the workplace. Because if we eliminate workplace transmission, we eliminate a lot of the community transmission that are associated with that. And then hospitals can be free to then work with cancer patients, patients that need heart surgeries and all these surgeries that are being delayed, kids that need important surgeries, at sick kids. A lot of are missing their, their windows of opportunity for surgeries because the hospitals are full of COVID patients and healthcare workers are getting infected. So they're staying at home, and they're also experiencing a lot of mental health issues because they're scared of getting infected at work. And it could have easily been prevented. And the tools are there. It's not like there's an N95 shortage either. We can easily give every Canadian N95s. We can give every Canadian an elastomeric respirator. We can give every Canadian that wants one in a surgical mask with bracers. So it's not like there's a supply shortage issue anymore. There's the will to stop transmission and keep Canadians safe is not there. And it's unusual because there's provinces that have NDP politicians in charge, provinces that have Liberal politicians in charge, and provinces that have PC politicians in charge, and they're all pretty much doing the same thing. So it doesn't matter which political party you belong to. And if, for example, the federal NDP started, as the federal NDP, Don Davies, the health critic who lives in Vancouver, if he started promoting the need to protect workers with airborne PPE, now that the federal government said it was airborne transmission, it would then make it harder for the BC NDP to say, there's no need to give people better protections, because then the public will be like, well, if the federal NDP and our member in Vancouver is now saying that we need it, why is the federal or provincial NDP not saying the same thing? And it would then help other provinces end up getting in line, because once one province starts putting airborne PPE into widespread use, it's going to make all the other provinces look bad. So it's just a matter of getting one province or another to finally actually protect workers. And then it could be a great example, because there are some great countries, like look at the size of China. China has quite a bit more, I try to sort of do quick math, 30 times more people than Canada. And for quite a while, they had like 10 cases or less per day. At the same time, Canada's having thousands of cases per day. And even Ontario's now back at over 1,000 cases per day. So provinces have more cases than in a country like China. Something has to be wrong. China started using a lot more effective PPE for healthcare workers in January 2020. So why couldn't healthcare workers in Manitoba get that protection? Why can't healthcare workers in Saskatchewan get the same level of protection Chinese healthcare workers are granted? We know it stopped healthcare worker transmission in China. So why can't we at least use those, what we know has worked? And even during SARS and H1N1, there was a PPE shortage, but the PPE shortage no longer exists. So there's no excuse that we can't protect the workers because the PPE is not there. The PPE is there, and manufacturers are closing down. So if we don't actually get the PPE to healthcare workers, we don't get it to teachers, we don't get it to meat plant workers, cashiers at the grocery store. In the future, that possibility is not going to be there. In the US alone, 6,000 jobs have been lost in the PPE manufacturing industry, and people continue to take risks. I'm not sure if you also saw in the US, it's not just masks, but gloves. It's an issue as well. Back in late October, CNN had a big investigation because there's a Thai distributor or Thai manufacturer of medical gloves. They imported 80 million used medical gloves to the US. And in February, importers were sounding the alarm because they bought millions of dollars worth of medical gloves, and they were selling it to hospitals, and hospitals are calling them. They're like, we're opening these boxes. These gloves have blood on them. They have stains. They have dates from being used 2 years ago. We can't use these. So the importers are then they told the government, you should look into this company. It's from Thailand. They're importing dangerous gloves. And the CNN investigation said the U.S. government didn't act until August. So between February and August, 80 million gloves, bloody medical gloves, made it into the U.S. just from one manufacturer alone. And the importers, 35 of the importers refused to speak to CNN, but one did. And he said, we couldn't, because they were used and bloody, we couldn't sell them to the hospitals as expected. So we sold them to the food supply chain at a cheaper price. So they're going to be used by restaurants and people handling the food supply across the U.S. When you're even in the hospitals, if you need a sterile environment and you're working on somebody and you're touching them with used medical gloves that have somebody else's blood from 2 years ago, where you don't know what's in that blood, or you're touching food that needs to be sterile and you're using used medical gloves, that's a huge national security risk. And nothing was really done. It was only once CNN started doing the investigation, a week after CNN did the investigation, then it embarrassed the Thai government. So the Thai government shut down the distributor. But the CNN investigation, the original one, said the Thai government spent 8 months trying to shut it down, and somehow they kept getting away. But then a week after CNN published it, then they quickly found out who it was, and they shut it down. And it was an ex-soldier with ties to the Thai government.
Mm.
So there's a lot of dangers by letting all these PPE imports that are either counterfeit or dangerous. And domestic suppliers in Canada have them readily available. In Canada, there's CAPAM, a Canadian association, the Canadian Association of PPE Manufacturers, and they have millions of N95s. They have some great surgical masks as well. You can also have bracers with them, and they also have elastomeric respirators. But people don't know that Canadian PPE is available. People don't know in the US it's available. So they'll keep taking risks. And that risk leads to people that think they're getting a real KN95 when it could be counterfeit. So they're not getting the protection they need. And some of the counterfeits were tested at 20%. CBC had an investigation in April. And even places like pharmacies and retailers in Canada, like major retailers in Canada, were buying counterfeit KN95s and selling it in their stores because they didn't realize that they weren't a good distributor and manufacturer, and they didn't do their research. So it's important for the public to know what tools are available, but it's also important for there to be a system to know where to actually get it safely. So the government should be letting people know in Canada, here's capital. In the US, here's AMMA. Here's all these places you can go. But their manufacturers came and advertised that they have their PPE available, and the government hasn't explained why they keep the ban in place. The government originally said the ban was only in place because there was a shortage and they were afraid masks would be taken from healthcare workers. But healthcare workers aren't getting the mask, and there's enough for every single person in the country. So there's no reason to have that in place unless you want manufacturers to struggle. And that's what's happening. So even in February, there was as healthcare workers in Ontario and the rest of Canada were reusing N95s for weeks at a time, there was a manufacturer in Kitchener, Ontario. He had millions of Health Canada approved N95s. And the Canadian government is saying, well, it's approved by Health Canada, but now you're going to have to get it approved by the US government as well. So why would you always think why wouldn't you need to get it just approved by Health Canada? Because Health Canada had higher standards than the American ones. So the NIOSH are great standards, but Health Canada standards were even better. So if you meet Health Canada standards, you're already going to meet the American ones. And if you're a Canadian company, why would you need to get approved in the US to sell it in Canada? It just doesn't make sense. So there's all kinds of hurdles being placed, preventing the effective mask from reaching people. And even the communication to get it for the people to understand the importance of it, it's not there.
A couple things I got to pick out of that, classic long tirade of yours. You mentioned a couple things before. I could probably answer, so you mentioned, sort of looking to China and their how they're helping out their healthcare workers. There's never going to be on a political level the sort of that comparison being made. It's just too radioactive. So it's not like Ottawa would ever go, well, look at they're doing this in China. Maybe we should do something comparable. It would just blow up too much. So in a lot of ways, you just sort of have to pretend China isn't there for certain things, and just sort of act like you're all figuring out on your own, and that there's not other examples abroad to look at. And then the other thing, if the federal government was going to start to try to impose something top down and try to get the provinces to act by withholding anything or do something along the lines that's disciplinary, that'll just never happen, because there's just too much political capital to be lost by going at war with the provinces. And so I think that kind of ties back to what happened at the beginning of the pandemic, where Ottawa was, like, we'll look after the borders, and once vaccines come out, we'll take care of the distribution and all that. But everything else is up to the provinces, because they didn't want to have to go to war with the provinces, because there's too much issues that can happen there, and they're not really sure beforehand, like, which provinces they'll be at war with. And there's some that this government in particular are more worried about than others. For instance, if they start butting heads with Saskatchewan, the federal Liberals, they don't care. Like the Liberals are pretty unpopular here, and they just don't care about Saskatchewan very much. But the big one where there is the most political capital is Quebec, and they just don't want to do anything that would even start that would have any tiny little tidbit of starting any sort of conflict with the government in Quebec. So they've just really stepped back from having any sort of disagreements with the provinces, because there's certain provinces, mainly Quebec and Ontario, that they just don't want to get into too much conflict with, particularly Quebec. So I could never see that happening. That just and that ties in with a lot what the federal government has done. Just sort of stand back, let the provinces screw everything up, and then it's not our problem. And then we also don't have to go to war with the province and then have issues that we have to deal with at the next election, whenever that is. And you'll let the provinces screw up, and you've seen like what happened in this earlier this year in the spring, when the Ford government in your neck of the woods said, "Oh, we'll wait. We'll see how bad this wave's going to be. We'll wait." And then he was up to his neck in shit, and then said, "Okay, now we'll try to take care of it, and quickly implement this lockdown." And the hospitals were screwed, and then Big Daddy Justin got to play hero and come in and help Ford get himself out of the big mess that he got himself in, and bring healthcare workers in from all over the place. He's bringing some in from Whitehorse and Newfoundland and all that. So I couldn't see those two things occurring on the federal government level. Just sort of acknowledging that some things different occurred in China because it's just too radioactive, and as well them trying to implement something on the provinces.
I think you're right, but one of the things the Canadian government can do is they can look at subsidizing masks for Canadians in workplaces, so they can come up with a system themselves. They don't have to wait on the provinces. The government, they see, well, it's been a month since we said it was airborne. Provinces still aren't doing shit. Well, why don't we work with the manufacturers ourselves? Why don't we end up working with all the manufacturers in Canada and saying, we'll buy your N95s, we'll buy your surgical masks with bracers, we'll buy your elastomeric respirators. So any small business or anybody, any Canadian that would like masking, they don't have to wait on the provinces. They can just get it directly from the federal government. And it could even be something that they could promote next time they have an election. They say during the pandemic, we stepped up while the provinces weren't able to do anything. We're the ones who ended up buying all this PPE for everyone, and we helped save the day. So, and then they could take credit for it. And then they could say, Ontario didn't stop the spread, but we ended up giving all these businesses in Ontario that wanted N95s. So then we stopped workplace transmission. So we avoided having to fight with the provinces. We just did the work ourselves. And then it also supports the manufacturers, and it could also create jobs as well. So there are all kinds of alternatives. And it would be very easy to do that because the federal government is already buying PPE. I have the numbers only up to March 31st of this year, but up to March 31st, they bought about 900 million worth of N95s. They bought $77 million worth of cloth masks. I don't even know why, because 76 million would be able to buy 3 million elastomeric respirators. So it almost protect. It would protect every single healthcare worker in Canada, every single federal employee, every single teacher, every single police officer in Canada and firefighter for within that 3 million for the same price they paid for cloth masks. So it becomes very effective as well. And then even federally, they spend a lot of money to then help provinces deal with like their emergencies when their hospitals are full, airlifting from Saskatchewan to Ontario and all these places that the prices add up. So the federal government does that. It would also save them a lot of money in the long run. And it would help save Canada's economy, because if we keep allowing the spread to go through in Canada, these workplaces are still going to close. With Omicron, it spread so fast that we might get to a point where we do have to do another lockdown. And then a lot of businesses are going to close because they can't survive another lockdown. So we can prevent it from getting to a point where there is a lockdown. And the federal government also spent $220 million on surgical masks. And normally it's the provinces that buy PPE for healthcare workers. So this is just on top of what the provinces have already been spending. And even if you were just looking at elastomeric respirators alone, it would cost $1 billion to give every single Canadian in the country their own elastomeric respirator, which is what they already spent on N95s. Mm-hmm. And not every Canadian would want that. So it wouldn't even be that amount they would spend. So it's a big amount. It's a very small amount to stop this spread in Canada. If the provinces don't want to do it, the federal government can do it. And if the federal government doesn't want to do it, at least let people know the importance of masks, because then philanthropic organizations could step in. Maybe some organizations could step in and say, well, we're going to buy these PPE to help protect the people in Ontario. We're going to buy PPE for hospitals. We're going to buy PPE for teachers because we know these respirators are good and they'll stop the spread, and we want to help these communities. But if the government's not even going to tell people these are great options, all these options are going to remain off the table. And the only options that are going to keep happening are the ones that we know don't work, like hand washing. So people are going to think that they just need to wash their hands and get vaccine, and then they're going to be safe. And then they're going to be caught off guard when they finally do get infected. And then they'll say, oh shit, like, what if I would have known to wear a N95? What if I would have known to wear a mask brace with my surgical mask? Like, I could have kept my family safe. I didn't have to get infected. And as a business owner, if you're having all kinds of business disruptions because of COVID, and even people don't want to shop at your business because they're afraid of getting infected from one of your employees, if you protect all your employees, you can keep COVID from spreading to customers. So it'll be a safer place for customers to then go into as well. And it could help slow down the spread. So if something like Omicron does spread in communities, it'll take longer to spread through those communities, and hospitals will have the time to get ready as well. Because we saw with Alberta what happened during the summer, just let it rip kind of thing. And their hospitals are still suffering now because of it. And we see, like with Delta, it was bad, and Omicron looks like it's going to be significantly worse than Delta. And we're still saying to use the things that we knew weren't working for Delta. So it is the provinces that are responsible, but the federal government has so many things they could also do to help. And just messaging and promoting messaging, and for example, the importance of masking would be such a big deal. And if they did promote effective masking, other countries would also know to do it as well. So a lot of countries don't know about effective masking because they rely on the US for information. They rely on countries like Canada that have all these big agencies that can do the research, because they don't have the resources to do that research. But if that research gets buried or doesn't get promoted, then we're not only harming Canadians, we're going to be harming people around the world.
Mm-hmm. So what incentive then does the Ontario Liberals and NDP have in at this point, just not speaking up about anything? And because you'd think, and I think we talked about this last time, is that, with there's when's your election coming up? Is it next year?
It's in June for Ontario.
Yeah, it's in June. Yeah, not that far away. That they would want as much to throw at the Ford government as possible. And so, like, why would the opposition parties in Ontario not want to speak out about any of this?
Especially when it's going to end up being used against them later on. Because a lot of this stuff was public. The public is going to be like, if you've known about this, why didn't you speak up? If you were speaking up about healthcare workers needing N95s in November and December of 2020, before the government was saying it was airborne, why are you not fighting for it now that the government has said it's airborne? And for example, with the NDP, why did they help me get elastomeric respirators recommended and then not say anything as the government decided to lock them up? And why did they also, for example, when Carol Hughes from the NDP, she got interviewed in November of 2020 for helping me get the federal government recommended. Why did she still say it was dangerous, too dangerous to use, and had to be corrected by the journalists talking with Ontario Health? Why wasn't that enough for the NDP to say, we're sorry for spreading misinformation about the valves, saying they were dangerous? Obviously, they're not dangerous. They're approved. They're recommended. We've known that the CDC have been using them safely for 25 years. the CDC pandemic plan from 2011 to early into the pandemic was to put them into widespread use. We know that there's N95s with valves that are being used all the time as well. We know the CDC recommends over 600 N95s for healthcare workers to use. We know they recommend elastomeric respirators. So why did they keep spreading misinformation instead of trying to fix it? So it's going to look bad because a lot of the information is out there. I made sure that the politicians cannot pretend like they didn't know about it in the future because I made it publicly. So I made sure that whenever there's an inquiry in the future, people are going to see that there were so many points throughout this pandemic that could have easily pivoted us out of the pandemic, could have easily stopped healthcare worker transmission after the first wave, but that nobody decided to do it. Even the simple fact of talking about a problem wasn't done. And in fact, for example, the union spent 6 months saying how the NDP is speaking up and that it's not worth it and doing this, while the NDP never spoke up. So if the NDP didn't speak up and the unions did, why weren't the unions asking them, especially when they had politicians from those parties running as federal candidates? They had the opportunity. They had the megahorn during, the NDP could have won a lot of votes from the federal Liberals during the election if the QP representative would have said, we're fighting. We represent QP during the day, but now we want to be NDP politicians. QP has been fighting Justin Trudeau for the last year to get better protections for healthcare workers throughout Canada, especially just mentioned, and getting the Canadian government to admit it's airborne, but they're not admitting it's airborne. They're not doing this. Even in June, the Toronto Star released Joe Vipon's article with Kashif, Dr. Kashif, sorry, I forget his last name.
That's escaping me too.
Yeah, it's escaping me, but there was three of them, Joe Vipon and him and somebody else. And it exposed how the Public Health Agency of Canada was told by the government to actively hide these studies on airborne transmission from the public, to not put it online, to only give it to people that know it, their titles and by name, and then don't even give it to everyone, give it to select few. And that was released in the Toronto Star in June. So how come that wasn't even mentioned during the election? Wouldn't the federal government actively hiding information that's valuable to ending the pandemic in Canada and protecting people be valuable for the NDP? And even the NDP, there was a House of Commons committee meeting on July 6th of 2020 where Mario Posamine, the lead SARS investigator, gave a big investigation. And even NDP health critic Don Davey said, we lost so much time. We delayed getting proper masks to healthcare workers. Healthcare workers desperately need N95s. They definitely need lots of more help. And all of a sudden, the NDP is the one that doesn't have that sense of urgency. And the things that we're asking for a year ago, they're not asking for now, and they have an easy opportunity to ask for it. So it's going to be a really strange time because every party screwed up, but parties like the Liberals and the NDP, for example, in Ontario, weren't in charge. So they might get it less of a fallback than the PCs, but we should still make sure that people like the health critics that knew about the problems, they don't just get to keep their jobs and say, we didn't know that it was important to say this, it wasn't important to speak up, because the unions have repeatedly said that they were supposed to speak up. And even though Michael Hurley will refuse to tag the NDP in posts, he said that he repeatedly asked the NDP to speak up about it. So there's so much information there that it's not like they can avoid it coming out, and they're just delaying the inevitable. And if they were to at least be the first ones to go out there and be like, we might have made a mistake, we should have spoken up, but we're not. But now we do want that help. And if it doesn't happen, if it's journalists that releases that information, and then the NDP have to act, they're not going to be able to then be the ones that say, the Liberals didn't do enough at a federal level. They should have done more. They should have spoken up. They should have acted with urgency, because the NDP were the ones that didn't act with urgency either, and didn't act with the interest of healthcare workers and even Canadians.
Well, I think what's going to end up happening is that they are going to just say that we didn't know at the time, and then just try to brush it under the rug. And I think a lot of the parties will all sort of change their position in unison, and then pretend just like nothing was going on, because there is a considerable amount of people who are trying to lobby the health agencies and these political parties to make some changes, but on the scale of the entire population, it is a very, very small minority, even though there are, a bunch of individuals, including you and I, who would like to see something or a whole bunch of things drastically change. So I just don't think that enough people are really paying attention at this point and, care enough to really, as a large group, try to push the political parties to make some change, and they might get away with it. And just go ahead.
The thing with using that excuse, and I think you're right. I think that's the excuse they're going to try and use is that's just as bad. You're a health critic. The unions were speaking up about this. So if the unions are speaking up about this, and you're a health critic, and you spent 2 years not knowing there was better PPE out there, and that the government had this PPE that could have stopped, then you're doing a shitty job as a health critic as well, even if your excuse is you didn't know. So if your job as a health critic to be there knowing, why are you spending your time wasting trying to get junk food bills passed when you should be focused on health critics or on health problems that relate to the pandemic, which is the biggest problem everybody faces across Canada and is a much bigger problem than junk food in all these other bills. Like it is an excuse, but it's going to be hard to do, especially the way I publicly asked them. The letters are there. For example, John Fraser officially asked. So his letter is always going to be there asking for these questions and admitting that he was looking into it. So he knew about the problem. So he can't pretend to say, I didn't know about this problem. And then even, for example, the federal Liberals like Brian Turnbull, he tweeted about how outraged he was in February about Ford withholding all these, the 100,000 respirators with the billions of dollars the federal government got for it. So it's not like the federal Liberals are going to be able to pretend like they didn't know about the problems happening at the provincial level as well. So it's going to be deny, but it's going to be hard to deny. And there's so much evidence out there that they have known for this time. And even people, for example, like Jamie West, he did answer me on Twitter and saying he wasn't aware about this. He does know about elastomeric respirators, but they're not asking him specifically. And there's all these issues. So they have talked about it as well. So they are on the record. And even Franchina, the CBC news article had to use Franchina's Facebook post to show the 100,000 purchase because the government hasn't officially issued a news release about the purchase themselves. So it's only through the journalists that I got to confront the government that there's actual evidence about these 100,000 in the news.
Now, before off air, we were talking about supply chain issues, and we were talking about issues that food banks are having. Maybe we can come back to some of that somehow. But is there a possibility that since we're going to have at least some problems, it's regarding all the supply backups that have been happening for a while, and then to what degree are the disruptions from the floods in BC going to have an effect? But if there starts to become an issue of importing all this crappy PPE from abroad, would that then push governments to be more reliant on a lot of the good PPE that is manufactured domestically?
Well, no, like the government has known for a long time that a lot of the PPE that becomes imported from countries like from China have been a lot of counterfeit. The CBC had a lot of investigations where they showed, I think it was 2 out of every 3 KN95s imported was counterfeit. Mm-hmm. So the majority is counterfeit. And they have long known that we've had domestic supply for a while. So if they did want to have better PPE in the supply chains, that we have it now, but by waiting, it's not going to be available down the road. So the more manufacturers that close down, if there's a manufacturer that says is on the fence, maybe I might start producing masks or I might not, and sees that a third of the manufacturers that opened up or half the manufacturers that opened up have closed down and people didn't even know they existed, then what would be the incentive for new people to start going into the PPE manufacturing business? And we're going to be stuck relying. And if we do lose these domestic manufacturers as we've been losing, we're going to be forced to buy PPE from China and hope it's not counterfeit. But every other country that used to rely on Canadian or US PPE, they're also going to be struggling as well because they can't buy Canadian PPE either since it won't be around. So it's going to be a very limited supply for the world. So we're going to have the same problems as we had the Wild West of the N95s during the first year of the pandemic.
Mm. Okay, that makes sense. Because even if there is, some sort of supply issues with the stuff abroad, it could push them to look domestically. A lot of those domestic suppliers might not be around anymore, or some have, as we've discussed before.
Yeah, and the Canadian government was still telling.
Yeah.
And the governments and Canadian government has been telling the people that there were shortages at the same time, even though there wasn't shortages. So at the same time as healthcare workers were reusing their N95s for weeks, there was brand new Health Canada approved N95s collecting dust on shelves. So the government doesn't act to help supply domestic manufacturers. They've actually done a lot more to help Chinese manufacturers than they have American and Canadian ones. Mm-hmm. Because a lot of the Chinese manufacturers, they don't have to go through the same approval process that American and Canadian ones have. And they also don't have to worry about the same bans on advertising that Canadian and American ones have. And they also don't have all the same troubles that our manufacturers face. So they have an easier time because the government says to buy KN95. The government doesn't say to buy N95s and support domestic manufacturers. They'll say to buy the KN95s and to buy Chinese manufacturers instead. And even news organizations in the US, like major ones, are telling people to actively avoid buying N95s because they assume there's still a shortage. And if major news organizations don't even know that the shortage is over and domestic PPE is readily available, what hope does the average person have?
Mm-hmm. So, one thing I've tried to touch on today and what I've tried to figure out a little bit, the first two times we talked, have you been able to figure out at all, like, what some of the actual incentives are for, like, we can see all the wrong-headed actions that have been taken as far as which PPE to recommend, which PPE to supply, but like it's hard to figure out what the actual incentives are from on some of the provincial governments and the federal government with because some of their actions are just seem so masochistic. Like, have you garnered any insight to that, or are you just focusing more on like just actually what they're doing and how insane it is, as opposed to like why they're thinking that way?
Well, I've been trying to add incentives. I've been saying, you can use it to save this part of the economy. If you're having supply chains, you can.
No. Like what are their not what the the incentives that they could have to do something positive. Like, what are their incentives to do this? It seems to be these really cynical actions. Like, what are their present incentives to act so poorly?
There's quite a few. So, for example, if you're a provincial government and you say everybody needs to use airborne protections because the virus has an airborne transmission aspect to it, then employers will start to be held liable for employees getting infected. Because right now, if the government says, it's not airborne, you're just going to get it from an infected surface, an employee could have touched a contaminated surface and then their face and say, aha, you touched a contaminated surface. You and your 30 coworkers touched the same surface and all got infected. But if it's airborne and 30 employees get infected and they weren't given proper masks, then it's on the employer to have put the employees at risk and not giving them the proper protection. Because if we know there's a risk in the workplace and the employer then lets that risk continue, then it's on the employer. And if for things like WSIB and all kinds of medical problems, like liability down the road, there's less liability on the employer and even the government itself, because the government's a big employer as well. So the government would start to have to protect teachers, healthcare workers, and every single government employee.
And so every time somebody got sick, then the public sector unions are down their throat with a sharpened broomstick.
Yeah, and it would be harder for employers to then say, I'm only going to give surgical or cloth masks because that's all the government has. And you saw with teachers were actually using better PPE. They were buying N95s themselves that were approved by the government, and then they were getting suspended for wearing N95s because the school boards were saying the government doesn't recommend N95s. The government only recommends cloth masks and surgical masks. So if you get something better on your own, you're going to get in trouble and you're going to get suspended. And even unions weren't even fighting.
Do you know of some incidents of that? Some specific incidents?
Yeah, there's a specific incident in Toronto. The CBC covered it. because back in October, on October 14th in Ontario, there was a day of action for Ontario schools, and the Canadian PPE Association, CAPM, they donated N100 disposable respirators to any teacher in Ontario that wanted it. And the CBC had some coverage as well, because the CBC was covering how teachers were getting suspended, because there was a teacher in Toronto. He had children that were immunocompromised, and he didn't want to get infected and then bring it home to his children. So he wore an N95s. And then the school principal found out, told him to take it off, and he got caught wearing it again. So he got sent home. And then when the donations came, the unions actually told teachers not to take the donations. And the unions were actually saying, don't wear N95s. If you wear, we do agree that N95s and N100s will fully protect you, while the surgical mask you're wearing will keep you at risk, but they're not recommended by the employer. So if you wear something that's not recommended by the province and the employer, we're not going to defend you if you get in trouble, and we're not going to help you out. And they were actively telling teachers not to try and protect themselves and take the day of action in their own hands. I think there were still 30 or 40,000 teachers that day that wore it, but it was a big problem, because the unions were actually trying to prevent their union members from taking safety into their own hands.
Holy crap! Okay, so yeah, that's sort of like what happened to Joe Vipon back at the very beginning of the pandemic. He got suspended for just wearing a mask.
Exactly.
Yeah.
And that's why it's important for the government to at least to help make sure everybody knows that N95s and better masks are recommended in the workplace. If you want to still let the employer choose what they want, at least let them choose what they want. But if those recommendations are there, it's going to be harder to penalize employees for trying to protect themselves from transmission. So if I have something that's recommended, I'm also more likely to, if I'm an employer who cares about my employees, to then get N95s or to get mask bracers to make the surgical mask effective, or I might even go get an elastomeric respirator for my employees, so I don't have to worry about going out and getting an N95 every couple of months. I might get it. For me, it might be more effective to get an elastomeric respirator. So I would get that. But if it's not recommended and I don't know it's something that can be used, why would I try and get that for my employees when I'm told a surgical mask or a cloth mask or all of that is needed? So that's why just simply recommending and giving the option of employers to do what they want is still a much better improvement than not even letting people know to use them.
Yeah. So to sort of wrap it up into a nice little neat package, the big issue then comes down to this, collective responsibility versus individual responsibility method of addressing the whole thing. So yeah, as you outlined, if you put it all down to the individual, then and that works in accordance with the droplet and fomite transmission concept, then you can circumvent all these liability issues. But if it's airborne, then it becomes more of this broader or wider problem, and more of a problem at the top. Actually, maybe not so much of a collective issue, but just sort of something that needs to be addressed better top down. And so, if you got people to wear better masks, then you'd have to acknowledge airborne, and then you got to worry about ventilation and all of that. So it's just better to stick with the status quo and just go along with the absolutely absurd theatrical nonsense of spraying everything down 37,000 times once every 5 minutes on the minute. And and then everybody wearing inadequate masks. I've heard about that a bit, but yeah, I've never entirely looked at it that way. But that makes a whole lot of sense. And then, of course, for the governments, then they're going to get lobbied from whatever sort of company, and then the governments, as you mentioned, don't want to have those conversations and problems with all the unions.
And it's the same thing with plexiglass barriers. Like a lot of the times, the plexiglass barriers are actually going to do more harm because now that we know it's airborne, it's not just going to hit the glass and stay there. It's
It
going to float
disrupts the
around
air
the air, go
circulation.
over the top, go through the sides.
Yeah.
And if somebody's infected, it's going to keep that infected air inside that plexiglass area for minutes, hours on end. So it's actually endangering people by keeping the rules and not letting them know it's airborne. And why is there no attempt by the CBC to have accountability and make sure that there's more talk about airborne transmission, talk about masks? Because even in June, when they released that one and done article investigation into the elastomeric respirators, they explained that they knew surgical masks weren't effective because without the seal, it would just leak on the sides. Mm-hmm. And after that article, even though admitting elastomeric respirators were safer, they pretended like they didn't exist. And they kept saying, oh, only N95s are safe. And then they started saying surgical masks are good as well. Like in November, just last month, I think it's, what's his name? Andrew Miller from the CBC had an article saying, there's airborne. It was a week before Canada admitted it was airborne, but he said, we should upgrade to better masks and people should start using surgical masks because that's what's good for airborne transmission. Even though the same CBC journalist the year before was saying surgical masks are dangerous and avoid them and we need better because they don't seal so the air can go through. And now they're going on the same page. And even with CBC Marketplace, it was a year ago where they told people to actively avoid using any respirator with a valve. I asked them a year ago to fix that misinformation because elastomeric respirators were approved. So obviously they're not all dangerous, especially if healthcare workers are using them. And the CBC said no. Back in August, I reached out to the CBC ombudsman, and Marketplace producer got back to me. She said, elastomeric respirators aren't recommended by the government. Our experts thinks that they're good as well, but they have the valve. And it would be too complicated to let the public know that some masks with valves are safe and others aren't. So we're just going to say they're all dangerous and should be all avoided, and not tell them what's going on. And she said, like, she made all kinds of excuses. And then I got back to her right away. I'm like, okay, well, if your expert didn't know elastomeric respirators were recommended by the government this whole time, then obviously you don't have the best expert on your hands. And why is misleading the public and saying they're all dangerous when you know it's safe? Why is that bad? And it could confuse the public. Well, that's why you should be telling them the truth, because I think not letting them know is a little bit more confusing than all of a sudden hearing from some people valves with respirators are safe and others. And then the CBC ombudsman got back to me. He said, he does think the CBC should have been talking more about elastomeric respirators, but he has no power to get them to start talking about it. And he doesn't understand why they didn't. But he agreed with the CBC Marketplace that it was better to not be transparent with the public and that some valves are safe and others. And he said it didn't matter if elastomeric respirators were recommended by the government and things like that. So the CBC is actively misleading the public. And so if politicians are saying these things and journalists, major news organizations, which we rely on, are spreading the same misinformation, then it's going to be hard for the public to understand what they need to do. And that's why it's important for podcasts like COVID On Air to be out there. That's why it's important for the World Health Network and all these experts like Dr. Jimenez and Kimberly Prathers and all these people to be spreading this information, because there's no incentive for politicians to do it. There's even news organizations, they know about the problems and they decide that it's better not to talk about the problems because it might be inconvenient. So that's why it's great to have things like Twitter and things like that, so we can actually see experts from around the world talking about the problems as they happen in other countries. Because in Canada, we're like in our own little bubble, and we don't see the problems that are happening in the US. We don't see the problems happening in Israel. We don't see the problems happening in South Africa. So it's important to have like a better view, because this is not a Canada pandemic problem. It's a global pandemic problem. And Canada is always just the last one to react. And unfortunately, we're all paying the price for it.
Sort of like that, one sort of bit that Rick Mercer used to have. Or a component of his talking to Americans bit. Like one of the things he would do sometimes is like they mention something that we've had for a long time, but sort of alluding to the fact that Canada is always a bit behind the US. So like ask them about how they feel about Canadians finally getting X. So he'd say like, oh, so what do you think about And it'd be in like 2002. You'd be like, so what do you think about Canada finally getting VCRs? Like, oh, yeah. Oh, congratulations, Canada, on getting VCRs, So that sort of plays in here. We're a little bit behind, but I think most countries have sort of had that problem where they sort of, just look inwards and then at times sort of pretend like what's going on in other places aren't going on because it's politically inconvenient. But you mentioned like the CBC ombudsman uh, brought up confusion. Well, you mentioned some things that like so much of this is already causing confusion if you're not giving out the proper information. But as far as confusion goes, like it's clear that there is mass confusion in the public in how people are going at each other, and then in just living in completely different universes from each other, and it just keeps getting worse and worse. And so, if you're worried about confusion, you sort of want everybody on the same page. And in part, like I have like tiny bits of sympathy for people who are really opposed to masks and vaccines and all that, although they're not being thorough with their rationale. But when the public health authorities are saying that the vaccines are they're all and everything, they're our way out, they're gonna solve the pandemic and polish your shoes. They just have everything all in one, and that's not the case. They're great at a lot of things, and they worked out a lot better than I would have anticipated. But the messaging on it was all wrong. And so when somebody's skeptical about the vaccines, whether they're just a bit worried about it or they have political suppositions that are leading them that way, they're going to start looking for things that are wrong. And when the public health authorities and the governments say that the vaccines are perfect, and then they start seeing these imperfections, then they'll jump on that. Or same with masks. So, well, we're all supposed to wear masks, and they're all supposed to do so great, and then they start seeing data that mask X and mask Y don't work so well. No, they're going to jump on that too and say, well, why are we wearing these goddamn things? And so it's just created this division. And that also then sort of works for the governments as well, is because then they have somebody to point their finger at to shed themselves of that responsibility. And of course, you've seen that a lot, and I'm sure everybody listening has seen that a lot, is that whenever a problem arises, well, the government can point at the evil anti-vaxxers and the evil anti-maskers, and that's the source of all their woes and all everybody's woes. And that's going to create so many more problems down the road, is having a population that's divided and scrapping with each other, for and gas is being poured on the fire cynically by people in government.
And you can see that with the vaccine alone approach, because right now, a lot of the governments are saying, either get vaccinated or lose your job. And they say the reason why they have to do that is because they need to prevent transmission. That's why they need people to get vaccinated. But they know the vaccines don't do a good job with transmission and mass do. So why aren't they saying use masks that will prevent transmission? Why aren't these politicians that are arguing against vaccine requirements saying we don't believe everyone should have to use vaccines? We think there should be alternative options if for those that can't get vaccinated to start using effective masking. But it's not that, it's vaccine or nothing. And then if vaccine is not used effectively either, and if you're an employee and you think that the vaccines are going to prevent transmission, you're not going to take extra precautions. You're not going to ask for better masking, and you're going to put yourself in harm's way. So that's why it's important to have as many options available. If the government wants to stop transmission, give everyone the vaccine, but then also give the option for better masking. If the government does want to stop transmission, why are they not at least recommending masks that prevent transmission? They readily admit that they're recommending masks that are only prevent spreading it to others. And we now know it doesn't even do that. It only slightly reduces your chances. So why can't we recommend masks to healthcare workers and teachers and all these people that are supposed to be getting vaccinated? Why can't we also give them the option to wear masks that will work with vaccines and will help prevent the transmission? because a healthcare worker, whether they have a vaccine or not, they could still get infected and spread it to the patient if they're in a surgical mask. And so it's not going to do very much for transmission. But if you then give a healthcare worker the vaccine and you give them an N95, they're not going to get infected. If they somehow do get infected, then they have the vaccine to help them prevent from getting hospitalized. But they're using the wrong tools, and then the tools that are effective, they're saying not to use them at all. So we could easily get us out of the pandemic. We could easily get like down to very little cases where it becomes manageable and it doesn't cause a big problem like it is now, by making sure the majority of people are vaccinated and people are put into widespread use with airborne PPE. But then we also improve ventilation. It could be as simple as opening a window in a room to improve ventilation. How hard is it to open a window? Maybe in the winter it's a little bit harder, but all that time during the summer where we had Delta spreading in Alberta, we could have easily, told employees, open a window, improve ventilation. Instead of having 4 exchanges in an hour, if you have a system, HVAC system, have an air exchange every 5 minutes, so that it doesn't stay suspended in the air for like 15 or 20 minutes during that amount of time. And we could dissipate the virus much quicker. But all the tools we're being told not to use, and then all the tools that are effective are just ignored. And it's the third year of the pandemic. It's not the third week. It's the third year. So how come we're almost worse off than we were at the start of the pandemic, where everybody was actually at least saying how important N95s were. At least people were saying we need N95s and we need masks. There's a shortage, but at least people were talking about how important it was for everyone to get those type of masks.
Yeah, it is. It is depressing to contemplate that maybe even things are even worse off than they were in March of last year. Oh boy.
Yeah, if N95s were readily available, teachers would have had them. Everybody would have had them, because the problem at that time was just that it was a shortage.
Could people, individuals in their own little workspace or something like that, how well do just like a normal, not the really small ones, but kind of the ones that are 3 feet high and skinny, those air purifiers, do they really do anything for like a smaller size room?
Don't really know as much about like the air purifiers. What's his name? I think David Elmstrom is a really good person for that. Jose Jimenez is a good person. Kimberly Prather is a good question for ventilation, but I'm not really sure about the air purifiers. I know even a simple do-it-yourself like furnace filter with those little $20 fans, and you put it in a box. Okay. And that is pretty effective, and it's not that expensive either. The Corsi Rosen, and they're so easy. Like you can do it with your kids, and then you can tell your kids to bring it to school, or you could bring it to your work or anything. But they're easy to make, and the tools are there. It's just people don't know where to look, and that there is something available that can prevent transmission. They're told the only thing that really does a good job at preventing transmission is the vaccine. So if you like vaccines, you might take it. But if you're already against vaccine, even if you know it prevents transmission, you might not take it. But you might take a mask. You might take an N95 over a vaccine. So their vaccines are very effective, but a lot of people are afraid because of the mixed messaging there's been around vaccines, both by journalists and by politicians. So if I'm on the fence, like I might not take a vaccine, but I might take a N95, or I might take a mask brace with my surgical mask. And if I knew more about vaccines, maybe I'd be more willing to take vaccines, especially if I know it's part of a multi-layered approach to safety. If I knew it's vaccines, masking, and I knew why each thing was important as a layered defense and as a safeguard. Like in the mining industry, there's safeguard after safeguard after safeguard. So if one fails, there's another safeguard to get you in place. But with the vaccine alone approach, if the vaccine fails to prevent transmission, people are getting long COVID and Omicron. And if Omicron is worse than Delta and it evades vaccines, but if it also produces more hospitalizations, then by the time it takes for the government to say, we fucked up, vaccines alone won't work, we need masks, it'll still take a while to get the masks into the workplaces. And so Omicron will keep spreading. It's not like it'll just be all of a sudden the government says, use N95s, use elastomeric respirators, use mask bracers, and it's going to be in every workplace. It's still going to take time. And during that time, Omicron's still going to spread, Delta's going to spread, and we're still going to have all these problems. It's not just the virus that delays, it's the acting delays because, and when the government does say there could be a supply shortage of proper masking, because if everyone all of a sudden wants masks, but all the manufacturers are now closed down, where are you going to find the masks? It might be hard to find the masks that you need. And then people are going to go to Amazon and just type in a KN95 because they don't know N95 is available, and just buy anything they know is available. And it could be easy for the government to come up with a reliable website. Like in the US, Project N95 is a great place where you can find reliable N95s. And why can't we have something reliable in Canada? Why can't the government just have a portal to say, we're going to be working with manufacturers. Here are manufacturers that are approved by Health Canada. Here's the types of masks they have, and here's what each mask can do for you. Why can't we do that? We have so many other systems that work like that, and it's not a hard system. It would help people know where to go. If they know there's a government approved area to go to domestic manufacturers, it'll be easier for domestic manufacturers to get their PPE to workers, and it'll be easier for employers and the public to get them as well. And right now it's just a guessing game, and you don't know what's safe, you don't know what's not. So it's not really effective way to stop a pandemic if you don't even know what's available to stop the spread.
Will they even bother, like if Omicron is as bad as Delta as far as causing illness and all that, will they even bother with updating any information on masks, or will they just go, you know what, we'll have a new Omicron mRNA vaccine by April, and maybe we'll start to give it to people by May or June or July. Just, hold off, and then they keep doing the same thing, social distance and X, Y, Z.
I think if a lot of countries don't start using airborne PPE, then yes, because the second, like one country like Canada or the US does it, it's going to be easier for the other countries to do it as well. And even if the UK does it, even if a country like France puts in widespread use of airborne PPE, it would become known in other parts of the world. And then it could be say, well, they did it, so why can't we stop the spread like here? Why can France have the opportunity to end workplace transmission, but in Canada it's beyond our means when we've had the manufacturers to do it for a long time? And I think Omicron is going to be the game changer people have been waiting for. There's going to be a lot of people that are going to suffer, unfortunately, but I think it's going to be a wake-up call that saying, even for the last 2 months before Omicron came out, a lot of the mainstream news were starting to say we should just learn to live with the virus. We should stop using masks. I think the Washington Post, and it was either in September or October, they said by December we should take masks away from kids because masks are going to do more harm. So we see we can't just live with the virus. We see living with the virus is what created Omicron. And if Omicron's bad, that's nothing. It's just going to get worse from here. It doesn't get better. It doesn't say, it got better after Delta. It's going to go, no, we're going to have these variants, and they're going to replace all the other ones. So if something can replace Delta really quickly, that's really concerning. And especially when it's easy to stop the spread. It's not like it's a magic that takes to stop the spread. It's tools that we've been using for SARS and H1N1. And even if we knew to use a precautionary principle like 20 years ago, when there was the possibility of airborne, now that we know for certainty it's airborne, it's not a precaution anymore. It just means it's just common sense to actually use what will help prevent transmission and not promote the stuff that doesn't help prevent transmission. We're wasting so much time just recommending hand washing. Instead of hand washing, insert effective masking. And how much more spread can we stop? How many lives can we save? How many economies can we save around the world by making sure that transmission is actually prevented?
So do you know, are there any countries yet that are looking like they're starting to sidestep more towards looking at airborne transmission as the predominant mode of transmission, so reality? Or is that just not really existing anywhere for sort of the same reasons that it's not happening in Canada and the US?
Well, it exists, but the countries don't do anything. Like the US on May 6th, either May 6th or May 7th, they admitted it was airborne. But then a week later, they told people not to wear masks at all. And then 2 months later, they said, don't wear a mask because vaccines alone will prevent transmission. And then 2 months later, they said, vaccines don't actually protect transmission. And they said, this virus is actually more transmissible now, but they never brought those mask mandates back in. So I think it'll end up being that places, they're going to be embarrassed, and eventually one news organization or another is going to talk about it. And then the governments are going to have to act. But what's also great is there's a 2022 midterms in the US. So both sides are going to want to talk about the negligence from the other, and both sides fight on the economy, and both sides have made mistakes. So both sides can call each other out. And for example, the Republicans, they might not want to call somebody, they might want to not do anything about vaccines, but they might say, why are you forcing people to lose their jobs if they don't want to take the vaccines? Why don't you then recommend airborne PPE, when since Biden administration said it was airborne? And that gives them a path to then talk about masks, because they don't like to talk about masks. But if they could talk about masks in a way so it makes the US government look bad for only using vaccines, then they might talk about it. And if the Biden administration could see that they can use domestic PPE and stuff like that to help save the economy, then they could say, while we help save the economy, we put all these measures in place, and we did something. But it's only going to be if there's public pressure, and without public pressure, there's no incentive to actually do any changes. So Omicron is going to be forcing people and journalists to start talking about how dangerous this virus is, how much it's spreading in South Africa. Unfortunately, we're going to wait till it's already spread quickly in the US and Canada to say, oh shit, it is bad. We should take precautions. Now let's start taking the precautions. We should have started taking the precautions last week when it was announced, but we can't even announce that we need airborne PPE a month after we admitted it was airborne. So what hope do we have of actually preventing Omicron from spreading across Canada and putting all our hospitals back at full capacity and our morgues at full capacity?
Oh, well, at this point, there's no hope of it not spreading across Canada. There's zero. Not that I've ever hoped for much, but it's just, as far as Omicron now, it's just a matter of just wait and see how much damage it causes. Maybe it's still possible that it might not fill up the hospitals and the morgues, because we just don't know how. I can say with certainty that there's going to be a lot of cases that just looking at anybody who I found to be credible is everybody's on the same page. It's going to be more evasive of the vaccines than any of the major variants we've seen so far, and it's going to be more transmissible than all the other major variants. So it's going to spread, and we're going to see a huge blow up of cases, and it's going to be kind of like what happened last year. The really bad point was just right at Christmas until the week after New Year's, just before Christmas to just after New Year's, all around the holidays. Then, of course, the holidays themselves would have exacerbated the issue. The way the timing is, it's probably going to be the same thing in Canada this year, the exact same time. But it's just, what will those cases translate into? Will they translate into as many hospitalizations and deaths? Well, we'll see. But the position that you and I are both going to have is I don't really want to wait and find out. I wish we would do a lot more just in case. Much from the beginning, it is better to overreact, because these issues scale and they can get out of hand really bad. And we've just run the same futile, inane exercise over and over and over again. We're going to do it this time. So I think for the most part, I'm you're the optimistic one and I'm the pessimistic one. And so that's always how it goes in these conversations. But at this point, it's just, we'll wait and see. And I think the best hope is just that the vaccines still hold out reasonably well. And maybe we'll get some more boosters for the older folks around. And so a lot of them end up okay. They get, a little more immunity from the vaccine and all that for around Christmas time. And maybe it won't be as illness causing as the preceding variants, but I have no idea on that front. That's
Well, it's
just
actually
that's just a finger cross. So
that's actually one of the good things from Omicron is people are now able to get their boosters a lot sooner than they were. The government's now pressured to release the boosters. I'm not sure how it is for Saskatchewan, but now I think it's in Ontario 50 and above. You can get your booster now. And it's actually because for so long the government was saying, "Oh, boosters weren't needed." Even after we saw in Israel, even after the U.S. admitted, Canada was still saying boosters aren't needed. You only need your 2 dose. And the third dose makes a big difference. Like the third dose for a lot of people can make the difference between having to be on a ventilator or just being at home, riding it out, and it just being more mild. Because the third dose will give you quite a bit more antibodies, so you do get that protection. So it's important for people to get that third dose as soon as possible and not delay it. And there's so many vaccine doses that are getting destroyed just because there's people that are taking it, so they're just sitting there and they're expiring.
yeah. Yeah, so I guess we'll see how it goes, but I don't think that there's going to be any updates on anything until, like, if Omicron is bad in all three of the boxes and then just
Mm-hmm.
takes off, and then even that it's a maybe. And you mentioned before about possible political angles in the United States. I also don't hold out much hope that the Republicans are going to take too strong of an angle on um, you know hitting the Democrats with not acknowledging airborne transmission enough and masks and all that. But we'll see. But yeah, I think they'll just take the position of, like, oh, look at the economy this, the economy that, and they're very very narrow vision of what the economy entails. I can't see the Republicans being very hawkish on masks anytime soon. But
Well, another thing they can use as well is domestic manufacturing, because domestic manufacturing is important to both parties.
yeah.
So they can raise how 6,000 jobs, over 6,000 jobs were lost in the last 6 to 8 months, and how it should have been the opposite. Instead of jobs being lost, it should have been jobs created.
Mhm.
And that Americans ended up supporting Chinese manufacturers instead of domestic ones. So that could be another angle that the Republicans use as well.
Yeah, I think we talked about that before regarding Canada. It's like, how wasn't in our last federal election? How wasn't that a Tory angle of looking after or of enhancing manufacturing, and helping issues regarding the pandemic, with boosting manufacturing in Ontario? Like, how did they not jump on that? It just boggles my mind, and it just seems contradictory to what they would want. But then again,
Hmm.
not always the best and the brightest.
That's why you become a politician.
Yeah, exactly. Yeah, well, look at the prime minister. We're scraping the bottom of the barrel these days. But yeah, we've been on here for a while, so let's sidestep to a couple other things. But like I mentioned before we went on the air, we were talking about um, a lot of major issues that are starting to accrue over so many jobs being lost over the course of the pandemic, and the amount of damage that it's causing to people's lives. And we were talking about before, and I didn't, it crossed my mind, but I never really looked into it or thought about it too much. But you were mentioning that a lot of food banks are having low supply, and that there's just so many more people that are poor, so that's going to have an effect on how much people are actually donating or able to donate to food banks. Food prices going up, that's going to have an impact on that. But is there anything else that you've been hearing about lately, about just from inflation, job losses, uh, of anything changing as far as our society degrading? Because, like, one thing that came to mind that I just started hearing about lately, but that's been a major issue this year that wasn't a big thing before, is just from so many people being worse off, that there's been this blow up of people going around and stealing catalytic converters from cars. It's been a huge endemic issue this year in Canada. I've heard of a lot of places out here. I've seen a lot of news stories from it happening in Ontario. People just going under cars and just ripping off or cutting off the catalytic converters and then selling them. And like even some stories of like people, like if you get under like a big truck or something, you just crawl under there and just like cut it off and then run away. But people even like jacking up cars, and there was a couple people that have died because they poorly jack up a car and they go under there to cut off the cat, and then the car lands on them, and then they're found dead the next day. It's like, well, like what else from what you've observed is really starting to add up from this dragging out?
A big problem is the CERB payments that the government was giving people. A lot of people desperately needed that, and people that are like low income and they're seniors as well, they ended up getting a little bit of CERB, and then it actually hurt them quite a bit, and then they weren't eligible after for other income they needed. And so a lot of people are now going and declaring bankruptcy because they have to repay all this money, and they're not eligible for all kinds of government loans and assistance because they use CERB. And at the same time, this is happening.
What did they have to repay?
CERB payments and there's different kinds of social assistance that was given throughout Canada. CERB being one of them.
Yeah. Did they have to actually repay the CERB, or was it because they got the CERB that they had to repay some of their other social assistance payments?
I think because they got the CERB, they weren't eligible for other social assistance, so they had to repay the other social assistance.
Okay.
Yeah. And then they also lost that social assistance, and they ended up losing CERB eventually as well.
Yeah.
But what is a big shocker is while the government's actually trying to get all the money back from these people that are 70, 80 years old and struggling to make ends meet, we found out a few days ago that the Ontario government gave $1 billion to businesses that weren't even eligible or took a lot more money than they needed. And they got more money than they even claimed for losses. And instead of trying to get money back from them, Doug Ford said, it's not worth trying to get money back for it. We'll just let them keep it. So it's all right for businesses that are making millions of dollars to take more money than they were even going to make without the pandemic. But people that are struggling to make ends meet, they can't get their social assistance anymore, and they have to pay all this money back. And for some reason, it's the people that are lobbying the government, they get all the benefits, and the people that don't have the money and don't have the voices or they don't have the support from a lot of different groups, they're just being left behind. So it's going to create a even bigger chasm between the people that have more money in Canada and the people that have less money. And it's going to create more people that need to try and do other things to try and then get to feed their family and make ends meet, and so they don't lose their house, because it's a common problem. Even on EI, like I was on EI myself. Like I lost my job last year, so I spent a lot of time on EI, and a lot of the times I had to call in every couple of weeks because they had to look at the file, and then they'll only look at the file once you upgrade it like 4 times, but you have to call in every 3 weeks. And then after 3 weeks, they say call in 2 weeks and then we'll upgrade it. And then 2 weeks later, it's okay, call in 1 week and we'll upgrade it a priority. And then in 1 week, it's 3 days and then it's 1 day. Well, why do I have to always call? Like I'm persistent, so I'll be doing that calling to make sure I can get my EI. But not everybody knows to call. Not everybody will keep doing that. Some people will just give up and then they don't have any money at all and don't support. So I think it's going to create quite a bit of a class system in Canada, because the people that do have a lot of money, they actually made quite a bit of money during the pandemic. And even in the US, the people that had billions of dollars, they have gone up by 30 to 50% in their wealth during the pandemic, while the bottom 99% have gone down by about 10, 15% and struggle. So it's the people that have been struggling before, they're just going to be struggling even more, and there's going to be less resources for them. And the businesses that were never struggling, they're now going to get all the resources that should have gone to the 99%.
Yeah. So what I heard about before was that, with the CERB payments, is that they anybody who couldn't repay them, they just gave up, and because there was a lot of people who weren't qualified, and it was easy to sign up and then get them, and so they said they were going to like come after them and try to get it, but then they just gave up. But yeah, I never thought about that. If you had them, and then you were on some other program, and how that could affect that program, not even at that point in time, with you having to repay that back on your next on your next tax return the next spring, but that it would just disrupt the future of you being on that program once the CRB ended. So yeah, that's, you know, especially if you're elderly, it's not like you can just like, oh, I'll get some extra jobs on the weekend, you know, make that all up. That's a catastrophe. And yeah, then there's the issue of, you know, so much money go to the top and not to the bottom, which was a problem before. That's been building and building since the 1970s.
Mhm.
But you know, like you can look at it, it was obvious from people at the start that would become an issue, because some people at home, they're going to be ordering from Amazon and so on and so forth. But even the way that a lot of the lockdown policies went, it's like, hey, we'll keep Burger King open, and we'll keep Walmart open, but you know, Bob's Spaghetti and, you know, Frank's Flowers, you know, they're done. You know, you guys got to shut down. But Walmart and Burger King and Amazon, it's like you guys can keep running. You're the cornerstones of our society. And so of course there was that, and yeah, that's just become more and more of an issue since. And yeah, if you're at the bottom struggling, like this pandemic was just a sledgehammer to the face. And you're sort of back to how I was and like you mentioned the Ford government giving away that billion and then just not caring. It's a huge shocker there. And people not really looking at that, but yet being distracted and going at each other's throats, similar to what's been going on with the vaccines and masks to a lesser degree. The same thing sort of happened with a lot of these government payments, is that you'll have just regular people getting on these new programs, and then others having animosity towards them, saying, oh, look at all these people getting all sorts of freebies and handouts. But and then it causing some conflict there, because people always have some sort of revulsion to somebody being on some sort of government program, when we're not really looking at the particulars of their situation, but then turning a blind eye when, you know, governments are giving handouts to all sorts of companies. And so there could have been more of helping people on the bottom who are just face so much hard times, and less subsidizing large corporations during the whole situation. So yeah, it's just been a huge mess.
Yeah, and the price of inflation has gone up. And so the price of all the food gone up, gas has gone up. So the people that have less money, they're going to spend whatever little on that. So a lot of people might even end up losing their homes. It's going to be like 2008 all over again, because the interest rate for mortgages is also going to go up. So the people are going to have to pay extra taxes, because now we have all these measures the Canadian and provincial governments have done. And if you look like you're an American, then there's trillions of dollars they use for infrastructure. So federal taxes are going to go up. Then even at the provincial level, you have all kinds of investment that the government did. So your taxes are going to go up for that way as well. But then you're also going to be paying more every month for your monthly mortgage. You're going to be paying more for gas. You're going to be paying more for food. And people's incomes aren't going to go up. And people's incomes might actually get less.
Oh, a lot of people's incomes have gone down and never gone back up.
Mm-hmm.
Yeah. And as you said, then more, issues with mortgage rates, gasoline is through the roof, and food's trickling up. Yeah.
And in the city too, I think I live in Sudbury. I think they said it's going to be a 4 or 5% tax increase next year. So your city tax
4 or 5. Wow. Yeah. People lose their minds here when it goes up 1.
And so it's just a snowball effect, and it's going to be death of 1,000 cuts for the lower income.
Yeah.
And then it's going to create more crime, because, if I can't afford to feed my family, like I might do something. I'll do whatever it takes to feed my family. I'm not going to let my family starve. So, there's going to be more crimes and more problems, and then it's going to lead to even more issues. And And we could be doing a lot more, but right now, like, we're not even trying to get $1 billion from the companies that made millions of dollars off people profiting during the pandemic. So why is that not important? Why is it more important to try and squeeze a penny out of somebody that doesn't have a penny rather than squeezing a dollar than somebody who has millions of dollars?
Mhm.
And like, if somebody made more money than they would have made without the pandemic, like, why did they have to make profit from the pandemic, like from the government and the taxpayer, and then not have to pay that back? Like, why is it important to get money back from an 80-year-old who struggles with to make ends meet, but somebody who has like 3 or 4 cars and lives in $1 million or $2 million house, he's going to be able to buy another another $100,000 vehicle because he just made that extra money from the taxpayers.
Yeah, and there's and I think that's going to worsen in 2022. There doesn't seem to be anything that's going to want to address it, and I think it's just going to keep getting more and more out of hand.
Well, a lot of companies might even go down because right now, this is a time of year where retailers make most of their money is the Christmas holidays, but because of supply chain, it's already going to be worse off. And with Omicron scaring a lot of people from in-person shopping, it's going to be a double-edged sword as well. So, and if you're in Canada and you rely on the West Coast to get your supply chain, the flooding is also going to make it even worse. So it's going to be all kinds of things happening at the same time. And these are manufacturers or companies that are struggling to make ends meet. And the third quarter was the economy only rose by a couple percentage points. So it was a lot worse than expected. So if during the holiday season, companies can't make up the money that they're expecting, and they're going to have to close their doors in the first few months of next year, or probably next year if they don't get government support. There's going to be more people out of job as well. And it's going to be even more harm to the economy. So there's going to be less taxpayers to then pay for all the taxes and the social assistance people are going to need. And a lot of these things were preventable. A lot of these things could be prevented by simple measures like opening a window or wearing a mask. But all of a sudden, that's not important. And all of a sudden, when we realize that it's time to act, it's going to be too late.
Yeah, so that just highlights like just how like it's taking care of the pandemic properly and looking after people. It's not just keeping people from having long COVID and keeping people out of the hospital. It's just it's all connected, and that just goes back to like this canard that has gone on for so long. People, we need to balance the economy and health. Well, there is no such thing. They're intertwined, and it's unavoidable. And yeah, so a lot of like some isn't totally connected. Like there's the BC floods that are going to cause they're going to exacerbate the bottlenecks, but the bottlenecks were already there before because of the pandemic. And but then so much else is just going to tie into it all because there's already so much economic harm, and that's just going to stack onto it. But anyway, it's getting pretty late in the day. We should wrap up soon, but you have a fancy new job. And
I do.
Yes, you do. So you should tell everybody about your fancy new job and what's going to be going on there, and what prospects we have from you and your fancy new job.
So I was just hired as executive director for the American Mask Manufacturers Association. They're also known as AMMA. This is an association that I helped create back in February in the US. Originally, we started with a little bit over 50 US manufacturers, and we were actually able to show the US government that domestic supply was in such high numbers that every single American who wanted N95, a surgical mask with a bracer, or elastomeric respirator could have it. So it was possible to now finally recommend widespread use of airborne PPE for all Americans. And then a month after we released our open letter, the U.S. government did declare the shortage over. But unfortunately, since that time, a lot of other problems have still occurred. So most people don't even know domestic manufacturing is high enough in numbers that it's reliable to be able to get it. So people still buy counterfeit PPE online because they just try and get whatever they can. So I am going to try and get the manufacturers the support they should have got a long time ago. And I'm also going to try and get the government to start working on production lines to also send PPE to other countries in need, such as Africa, Southeast Asia, and South America, because along with vaccines, we could be sending them PPE to stop the spread. So variants like Omicron, it'll be less likely to develop. And if a new dangerous variant does develop, having airborne PPE in these countries will help slow the spread. So even when it comes back to the US or UK or any other country around the world, it'll give countries around the world time to then get ready for that new variant so that it doesn't quickly spread through their countries. And so we don't have to do shutdowns or lockdowns and even close borders and travel restrictions, because we'll have time to actually stop the spread. And it might even make it so that it doesn't even leave the country. It could stamp out the spread. If we start giving people airborne PPE and there's less transmission, then it might not have enough people to reproduce in and then get transmitted to other countries. And there are some great politicians. I saw an open letter by 11 U.S. Democrats, and including Bernie Sanders and Elizabeth Warren. And they're already looking to do some to help domestic manufacturers. So I'm going to try and reach out to them and try and work with them as well, because a lot of the problems, the politicians don't necessarily know about the problems because the journalists don't talk about it. Mm-hmm. So I'm going to try and then get a hold of the politicians and work with them to make these changes. And I'm also going to try and get them to also start promoting the importance of airborne PPE, because one of the problems, if they don't think it's available, then it might be harder for them to want to promote it as an option. But if they know it's readily available, then it becomes easier for an option for all American workers to get the protections they need. And it's not that hard to protect, to work with the U.S. manufacturers. And some of the things I'm also going to try and do for these manufacturers is I'm going to try and get government support to offer free government shipping for, like in the US, it's USPS, in Canada, it's the equivalent's Canada Post. Mm-hmm. But for things like masks, tests, or anything that's a COVID essential, if the US government takes care of the shipping costs, it's less for the consumer and also the manufacturer. So it becomes more easily accessible to then provide domestic PPE, domestic testing, whatever you need to stay safe. And it becomes more of a cost-effective option for everyone. So if I'm an employer and I only have a limited amount of resources, I'm more likely to then get my employees the PPE they need if it becomes cost-effective. So I'm also going to try and see if I can get the government to subsidize PPE for workplaces that can't afford it, or for the public that can't afford it, because a $25 elastomeric respirator, or $25 supply of N95s or surgical masks with bracers will save the government thousands of dollars from ICU admissions and all these hospital admissions. And it's also going to solve the supply chain issues. So we can effectively end the pandemic, so that this will actually be the last wave. Even though they say every time it's the last wave and the pandemic's over, it could actually be the last wave if we actually put in, if we actually get the layers of protection we needed from the very start.
So in the American context, if get through to somebody with the idea of waiving shipping costs on tests, PP, et cetera, would that be something that Congress would have to address, or the White House?
I think it could be done with an executive order through President Biden, but the Congress could probably do it as well. But I think it would be effective to do it with all of the branches. So that one branch doesn't try and slow it down. Do it with everyone, and even with both sides, because a lot of the Republicans don't want the spread either. So I can try and work with both Democrats and Republicans to try and protect Americans, work with domestic manufacturing. So it's going to create a lot of jobs in the U.S. It's also going to save the economy a lot of money, because if you don't have to pay $1 trillion every few months to try and stimulate the economy, that's a lot easier for the government. And especially if they only have to spend a few $1 billion to get PPE to all Americans, it's going to help quite a bit. And they're already doing it with at-home testing right now. They're looking to make at-home testing available for free to all Americans. So people with private insurance, they can get it through their insurance providers. But if not, there's going to be distribution centers in different cities around the U.S. so they could still get their free testing. And so I'm going to try and get something like that as well, because insurance companies would like to have insurance themselves. Because if you have a $200,000 ICU bill in the U.S., or you can spend $20 to prevent having a $200,000 medical bill. Then it becomes a lot more effective and cost effective from the insurance provider standpoint. And it's not just a hospital bill, but if people aren't dying from COVID, then you don't have to pay all these life insurance premiums and things like that as well. So it becomes a very cost effective aspect for insurance. I'm going to try a multi-layered approach to try and get as much PPE to everybody in the US, but also to try and get it to people around the world as well.
And is there anything else you plan to work on with the AMMA?
Yeah, I'm going to be releasing an open letter. I'm going to be trying to meet with the manufacturers this week, and if they approve of the open letter, then I'm going to try and release it, and I'm going to try and work with different news organizations to release it at the same time, so that there's that it's talked about by CNN, Washington Post, so it's not doesn't just fall through the crack. It's something that everybody can talk about, so it can help a lot of people. And then the same things that happen in the US, Canada could look at and say, maybe we can offer the Canadian Association free Canada post shipping as well. Maybe we can work with them as well to get their PPE to workplaces and around Canada, and even subsidize it. And even Canada, they send vaccines to other countries, so they can start a program to also send Canadian made in Canada PPE as well.
Cool. Well, it looks like you're having a bitch of a time over there with your tablet and everything. So I think let's call it a day. You can still find Nick at PP Heroes on Twitter, and I guess where should they look up things about the AMMA?
Well, there's the AMMA website, and that is. Here, one second, I can get you the exact website. So that is ammaunited.org, AMMAUNITED.org. And that's where you can find a lot more about AMMA. There's news articles about our association, our open letter, and all the members as well. And I'm going to also try and grow the association even more, so it becomes an even more powerful association. It can do a lot more good around the world.
Cool. There we go. Let's leave it there. Cheers.
Cheers.
Thanks for listening to the show, everybody. There'll be more episodes coming for you in the future. Be sure to check out endcoronavirus.org and worldhealthnetwork.global for more information on the organization. Thanks to Michelle from Make Good Together for doing the graphics for the show, and a huge thanks to Tracy, the noble producer of the show. If you listen to the show on either YouTube or podcast format, well, they are available on both, and be sure to like and subscribe and comment on those. All the best. Till next time.